Commissioners, today is September 12th, 2018. Let's start with a roll call, please.
Chairman Klein,
Here.
Commissioner Uri,
Here.
Commissioner Wellens,
Here.
Commissioner Barry,
Here.
Commissioner Gregoire. Here.
Thank you. Pledge of Allegiance, Commissioner Uri. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Mr. Vice Chairman. Public comments. Do we have any public comments this afternoon?
Yes, we do. Former Commissioner Coble.
Mr. Cobo?
Good afternoon. First of all, I want to say since I'm so lucky that every day is Saturday, I enjoyed being here today and listening to the interaction. Congratulations. I think overall you guys are getting focused and doing a good job. I would like to make a comment because I was sitting here and I was listening to myself, and I wondered, Commissioner Wellen, if you have read the charter, and have you read what a commissioner can or cannot do under the legislative change in 2006, where a commissioner can ask questions, but not instruct or direct non-reporting employees? And it's the senior management's courtesy, as I remember, unless it's changed, to ask commissioners to interview somebody, but you really can't mandate it. I think you ought to read that, sir. I think that we had enough issues with board issues at Broward Health, and I think you need to read that malfeasance. Thank you and have a wonderful day.
Commissioner Wellens, just to clarify also that the board bylaws require a board report to be involved in the interview process for the senior people under the bylaws of the district.
I believe, Madam General Counsel, and I'm not an attorney, to their direct reportees, if I don't, unless it's changed, and if it has, please show it to me, because the CEO has the directive to hire her staff, and as a courtesy can ask the commissioners to interview, not even as chairman of the human resource. Can you direct another employee to do something? You can ask questions, but I could be wrong. But if you have it in writing, please provide it for me.
Okay, are there any other public comments?
No, they are not.
Okay, thank you, Patricia. At this point, we're going to move on to ratification of the Chief Executive Officer of Broward Health Medical Center.
Thank you, Commissioner Klein. We are very excited. We conducted a national search for a CEO here. We narrowed it down to 3 very well qualified candidates, and we flew one in, and he interviewed with the team. He interviewed with our medical staff, several members of our medical staff, and he also, Commissioner Wellens, got an opportunity to interview him as well. And so we were pleased to make an offer to him. I'll tell you a little bit about him. His name is Jonathan Turton. He's a senior healthcare executive. He has more than 20 years of experience leading complex healthcare systems. Most recently, Jonathan served as the CEO for the Tenet Healthcare-owned Baptist Medical Center in San Antonio, Texas. In that position, he led the 623 licensed acute care hospital, which is their flagship, to maintain a 13% operating margin over 3 years. He also developed and implemented a new service line strategy, driving quality improvement in cardiovascular, nephrology, and geriatrics, while maintaining a focus on clinical outcomes and patient experience. Previous to that, he served as the hospital's chief operating officer, managing 15 direct reports and $190 million annual operating budget. And then prior to 2012, he served with CHI over at St. Joseph's Health System in Bryan, Texas, and he held various roles there, including VP of Clinical Services, VP of Outpatient Services, and VP of Rehab Service and Business Development. He has an MBA from Texas A&M University, and he's also a fellow in the American College of Healthcare Executives. So with that, he is here today, so we can introduce him, but I thought I'd read the ratification required language, and then at which time he can stand up and introduce himself. And I believe I have to read every word on this, so bear with me. Resolution 18-09-12-01, resolution of the Board of Commissioners of the North Broward Hospital District approving appointment of Chief Executive Officer of Broward Health Medical Center. Whereas pursuant to Article 5, Section 5 of the bylaws of the North Broward Hospital District, the authorities and duties of the President Chief Executive Officer include appointing, with the approval of the Board of Commissioners, certain senior executives, including regional chief executive officers. Whereas the President Chief Executive Officer has appointed Jonathan Turton as the Chief Executive Officer of Broward Health Medical Center, consistent with the North Broward Hospital District policies and procedures. Whereas the Board of Commissioners approves of Jonathan Turton as Chief Executive Officer of Broward Health Medical Center. Now, therefore, be it resolved by the Board of Commissioners of the North Broward Hospital District that 1. Jonathan Turton is hereby approved as Chief Executive Officer of Broward Health Medical Center, passed, adopted, and approved this 12th day of September 2018, and if approved as a resolution, both Commissioner Klein and Commissioner Berry, as the Chairman and Treasurer, would sign off on this resolution.
Okay, thank you, Gino. Why don't we hear from Mr. Turton first, and then I'll entertain a motion to approve the resolution.
Don't screw it up.
Birthday that way. Well, I appreciate the opportunity to be here. I am so excited to have the opportunity to be part of Broward County, to serve alongside the employees, the physicians, and provide care for patients. I've been doing this for well over 25 years across my career, and the chance to come to Florida, where I have lots of family, and can be part of this organization, it's great. I've got some great experiences, and I look forward to learning even more and participating alongside my colleagues. And I just want to thank the Broward Health senior leaders, this A-team, and Mr. Wellens for the opportunity to come here and call this home. So thank you very much.
Thank you. So we're happy to well, I guess we need to get
I make a motion that we ratify Mr. Turton as Chief Executive Officer of Broward Health Medical Center.
Via adoption of the resolution.
Yeah, via adoption of resolution 18-09-12-01.
A second.
Motion made and seconded. Any further discussion on the motion? Not all those in favor?
Aye.
Any opposed? Congratulations, sir. Welcome aboard.
Thank you very much.
When does he start?
Monday.
Mr. Chairman, can I make a clarification on Gino?
Please.
I didn't interview Mr. Turton. I met with Mr. Turton as a courtesy as a board designee. That was a selection made by the executive management team, and I was a designee for the board to meet any CEOs or senior management team that they asked to have a conversation with. And it was a pleasure meeting. I had a 10-minute meeting. I think we spent about an hour and a half, and we've got a lot of similar interests. So I really look forward to having you part of Broward Health.
That's correct. Sorry for that misclarification. And also thank you because you came on about 3 minutes notice. So appreciate it.
And certainly it's a big undertaking. It's a large hospital here, and we're happy to have a new CEO on board. Happy to have Gino back full-time as COO of the system. Thank you for filling in admirably as interim CEO here and wearing that hat. So thank you, and again, welcome aboard, Mr. Turton. We look forward to hearing great things about what you're doing here and continue the improvements. Moving on to the next item, Joint Conference Committee Medical Staff Chair Appointment. Whose item is this?
This was when we discussed about the joint conference chair.
Yes.
And Dr. Ta will probably be able to speak on this.
Okay, Dr. Ta, this is the medical staff chair appointment for the Joint Conference Committee?
That's correct. So the next step is to call a joint conference committee so the committee members can vote on the incoming chair. We alternate chair between the chair of the board commissioner and the chair of the medical staff.
Yes. Okay, so just so everyone's aware, the chairmanship of the Joint Conference Committee alternates between the board and the medical staff year after year. This is the medical staff turn to have that chairmanship. So we'll be calling a Joint Conference Committee meeting, at which point the committee will appoint or elect a chair for that committee. Thank you, Dr. Ta.
Next item is approval of the minutes. Item 2, approval of the rescheduled June board meeting minutes dated July 26, 2018. Are there any questions on the minutes as drafted? If not, is there a motion to approve those minutes? Motion made and seconded. All those in favor? Aye. Any opposed? Motion carries. Next item is approval of the regular board meeting minutes dated July 26, 2018. Any questions or discussion on that item?
Just one, on page 5.
On your microphone, Commissioner? Commissioner Goodward?
Oh, sorry. On page 5, towards the bottom of the page, it says Commissioner Gregoire approved up to $1 million. I think it means moved to approve.
You approved it.
I had a lot of help.
Okay, so I guess we'd like to modify the minutes to state Commissioner Gregoire moved to approve up to $1 million in locums. Is that acceptable? I guess that's your role, as the secretary. So.
Yes.
Thank you.
Okay, is there anything else on the minutes from that July 26th regular board meeting? Okay, is there a motion to approve as amended?
So moved.
Second. Any further discussion? If not, all those in favor? Aye.
Aye.
Any opposed? Motion carries. Next item, item 4, approval of special board workshop meeting minutes related to CEO metrics dated July 26, 2018. Tab 4 in the materials.
Move to approve.
Motion's been made and seconded. Any further discussion? Not all those in favor?
Aye.
Any opposed? Motion carries. Item 5, approval of the special board workshop meeting minutes related to the balanced scorecard for management incentive plan dated July 26, 2018, tab 5. Any discussion or motion relative to approval?
Move to approve.
Motion made and seconded. Any further discussion? Not all those in favor, please say aye.
Aye.
Any opposed? Motion carries. Minutes are all approved. Let's move on to the next item, which is committee reports from earlier today, beginning with the Finance Committee. Secretary Treasurer Berry.
So we had a good Finance Committee meeting. We started to talk about this small document to review, and I believe we're going to move to, it's got a preliminary approval. Essentially, we're moving to approve this at the 26th, on the 26th. So we had a good discussion about that. We had a discussion about the budgets of the direct reports. There's some follow-up that we're going to do there, but meeting went well, and we're moving along on the 2018-2019 budget.
Okay. Thank you, Commissioner Berry. Compliance Committee, Commissioner Gregoire.
So we discussed, Mr. Hartfield told us that he has a new regional compliance manager and he's still looking to fill some staff spots. We discussed my call with Laura Ellis, the monitor, and Mr. Klein's visit with Laura Ellis, the monitor, and she has some concerns, but she sees that we're improving and she sees that we're getting the job done. Many of the concerns relate to the contracting process and Compliance 360, but that's being resolved. And we briefly discussed the IOO report, but we will be focusing on that next month instead of this month.
Thank you, Commissioner Gregoire. Human Resource Committee, Commissioner Wellens.
Yes. So we discussed our new board liaison and converting that role potentially into an exempt employee and creating an office of the Board of Commissioners. We discussed hiring potentially an assistant for that for Patricia Farrow, who's in that role for a short period of time and is starting to develop. We'll be back on October to clarify that and finish that. We discussed a new contract, which will be a template for the North Broward Hospital District for board reports. It's in draft format. Will be reviewed in October. Finalized and recommended to the board after the Board of Commissioners and everybody's had a chance to review it and make any additional comments. We are looking at establishing a contracting process for each individual board report how we would go from once the candidate's selected to the actual contract. We're putting that process in place, and we hope to, again, have that finished in October. We talked about our interim HR leadership and what we're doing there in terms of hiring a senior vice president of HR. We have an action plan that we're putting together. The CEO and the CFO, Chief Operating Officer, will be contracting an executive search firm and start that process, as well as a number of internal postings. I do want to clarify, I think it was clear to senior management that I wasn't demanding to meet the candidate. As a courtesy, I'd like to meet the candidate. If there was if clarification necessary, I think that was understood, that it's a courtesy. I'd like to meet the individual just as we do with others. We are going to discuss the personnel policy as it relates to the 4 board reports and potentially a 5th board report should it need, and that will be brought back in October as well. We had a presentation from the internal auditor who laid out a budget, and we've asked for some additional items and for additional staffing requests, and we hope to have that completed and ready to go for the 26th. And we did schedule a review second meeting for the CEO metrics, and that will be October as well. And I believe that the date we selected was October 9th for HR, and all of these items should be completed at the end of that meeting, and we'll start a new list of items on HR going forward. And that's it.
Thank you, Commissioner Wellens. We're going to move on to the medical staff facility updates, beginning with the Chief of Staff reports from Broward Health North, Dr. Maheshwari, or Dr. Todd.
Due to scheduling conflicts, Dr. Maheshwari and Dr. Jensen were unable to make it, so they will not have any report today.
Okay, so that will take care of North and Imperial Point. Broward Health Coral Springs, Dr. Zingaro.
Good afternoon, Mr. Chairman, Commissioners.
Good afternoon.
I just want to report that we had a wonderful grand opening of the new South Tower at Coral Springs Medical Center, and thank you for those of you who attended. And I think it was great for the facility, great for the system, and we're very proud, and we're moving forward to transition some of the floors over to the new wing, and we're really excited about it. I know the staff is, and Jared's really working hard to have a true smooth transition into the new wing, and I think it's going to be great. So we look forward to that. I also I was not here for the end of the last meeting to thank you for approving the robots that are being delivered Friday. So they're coming in by robotic on Friday. So that's going to be a big addition to our surgical program, which we need to recoup from, unfortunately, attrition. But I think there's our administration there is working very hard to bring back surgeons and to revive the program, the wonderful program we once had at Coral Springs. I think we can do it again, and I think adding the state-of-the-art equipment will entice, and it'll be good for patient care. Bottom line is for patient care. That's what counts. We were also working collaboratively with the administration to let them know that we were lacking some service lines, and Jared's working very hard to fill these needs with you all. But I'm not going to belabor the point, but we do have a few service lines that are needed to care for uninsured patients at Broward Health Coral Springs. I think that's related to the PPUC program, or lack of program, or contracts, or lack of contracts. I think that's the latest dirty word is contract, I guess. But GI, infectious disease, pulmonary, and nephrology, which are vital to the care of our patients. We need to have those physicians. I'm not talking about emergency call, because I know Gino is working out that with their on-call schedule contracts, but these are just individual consultative contracts. So I just want to bring it to the board's attention that we need to try to get these contracts
taken care of timely so that our patients don't suffer, and we can get adequate care and appropriate care for our patients, and we don't have to be transferring them to another facility. So just to bring that to your attention. Thank you for that.
Thank you. So we have the new building, we've got the 2 Da Vinci XIs, we've got the facilities. We need to make sure we have the coverage for the physicians.
What is what is the issue with the contracts or whatever? Is it fair market value issue? Is it?
Is this one where they used to get paid ER on call?
No, I think you've separated the ER. I think you're combining the ER.
Yeah, I think what happened with this, correct me if I'm wrong, but I think what happened with this one is, so we've transitioned most of our ER on-call arrangements from, it used to be a contract that included a daily rate plus fee for service. So our directive was we were going to move away from that combination and just go for the daily rate. It's easier, it's less costly for both the providers and us to have to manage the administrative piece of it. So what we did was we got an FMV for every single specialty where we were providing that service, and then we started transitioning them on the new contracts. There were some specialties, I'll use neurosurgery as an example at Coral Springs, I'm most familiar with that one, where the fair market value that also has a commercial reasonableness component could not be met because the number of times that the physician would come in for the ER call was like minimal, very minimal.
Right.
So what we're doing in those scenarios is we're trying to work out either one of two options. Either A, if it so necessitates, we may be able to do an activation fee on the specialties that would make sense. But B, what we could do for everyone is the standalone PPUC fee for service agreement. So they're not on call, but if there's an arrangement where they need to come in and there's an indigent patient, they would be able to be billed TCA through PPUC. That's where I
right. But the other service lines that I'm referring to are service lines that have been covered in the past. We have never had a GI on call at Broward Health Coral Springs. 32 years I've been there. We usually leave it up to the primary care physician to call his or her consultant of choice. That being said, in the past there were PPUC contracts for those who want to sign up to be able to serve the underinsured or non-insured patients and work it out through Broward Health. Unfortunately, that has shrunk. I mean, I'm not here to talk for them, but it has come down to it. There's only a few physicians now who are willing to do that. And those physicians, apparently in GI, for instance, we have 4 physicians who are volunteering to do that, and they haven't gotten it. It has nothing to do with the on-call ER stuff. So it has to do with pulmonary in-house. We've had to transfer patients, infectious disease recently, GI recently, and nephrology also. And there's a lot of nephrologists on staff out there now. About 15 just came aboard. So we have the docs who are willing to see patients. We just need to get the paperwork done for them.
And what kind of timeframes are we talking about? And how long has this been going on? Where you've been trying to get these contracts done?
Maybe I don't know. I don't want to put Jared on the spot, but I can't give you those exact time frames. All I do is I hear from my fellow physicians in the lunchroom about, this PPUC has been terminated. It's not been renewed. I mean, somebody had one, it hasn't been renewed, so they have to redo it. And how long is that taking? You'll have to talk to the people that do those things to see how long it's taking, because I don't have the answer for you.
Well, perhaps what we can do is that we're meeting in 2 weeks again as a board. I know we've been talking about contract streamlining. Why don't we look into the physician contracting streamlining process and start getting some standardization there, so that we know when the physicians and the administration will know what the lead time is, what the standard time frame is, and let's get these things moving forward. This is an issue I've been hearing about, and I don't like hearing about issues not getting resolved. So I'll place this on the agenda. Patricia, if you can make a note, on September 26th, we'll be reconvening as a board, and we'll put this on the agenda and hopefully make some progress on this issue.
Yeah, we were supposed to have a system whereby when someone's contract was coming up for renewal, there would be at least a 6-month lead time, and then again at 3 months to get the ball rolling in a timely fashion. So it wouldn't it wouldn't become gridlock at the end of the day. So maybe we can readdress that issue and get that straightened out for the physicians that need to serve the patients.
Absolutely. Okay. And in my meeting with our federal monitor, and she indicated, she understands that contracts need to get done. There need to be standardization, and certainly compliance shouldn't hold us up from getting our contracts done. But we need to know what the lead times are and what the process, should be.
I don't think this. I'm going to look at this one. I don't think this is the contract process. I don't think it's compliance. I don't think it's legal. I think this is part of us. It might be part of us catching up, because usually I hear about the ones that have been a while. I haven't heard about these yet, but I will work with Jared and figure out what this is, and we'll fix it. Because the PPUC, just so you know, we have the template's already done. We have the fair market value is easy, so that one we've pushed them through in 7 days. So I'll help to get that done.
Yeah,
and why is there a declining number of physicians willing to do PPUC?
Oh, Commissioner, that's a long story. I can't take up your time here today.
Make it a short story.
I'll tell you about it. Well, I guess it's reimbursement liability. A lot of times, patients who the system has evolved over many, many years. As a physician, I used to be able to, I was on that program at one time, and I used to be able to see a patient in the hospital, perform a service, and if they needed a follow-up, I was able to see them in the office, and perhaps if they needed a follow-up endoscopy for a gastric ulcer, I would be compensated to bring that patient back on a need basis to have a reevaluation, and it would be covered. After that, when you treat the patient, you're done. That system kind of evolved into something different. Let's put it that way. So and then what happened with those PPUC patients is that a lot of them were converted to Medicaid. Okay, so you would go and submit your billing to PPUC, and it would be a delay, and then they would say, well, it's delayed. Then you call back and they say, well, that patient now has Medicaid. Go get paid by Medicaid. So that was a real disincentive for physicians to continue to stay in that program and be a part of that program, when you're almost disincentivized to see those patients by being tossed down the road and say, okay, well, your claim is pending. Oh, by the way, they just got converted to Medicaid. Go get your money from Medicaid. So I don't need to explain that to you all.
No, I get it. Thank you.
Okay, that's the Reader's Digest board version of that. So the other thing I just want to point out is we would like to see any commissioners invited to a chief of staff meeting. Unfortunately, we didn't have an attendee a couple weeks ago, but you're all invited to attend. I know it has to be one at a time, but you're all welcome to have input or be there to input or listen, whatever your desire is. So you're welcome, and we welcome you to come.
Well, why don't we do this? Why don't you communicate through Patricia when you're having those meetings, and she'll communicate with the commissioners.
It's right before the standard board meeting at 3 o'clock.
Okay.
So it's at 3 o'clock before the 4 o'clock board meeting.
So it's always 1 hour before our board meeting.
It's usually 1 hour before. And if you require more time, we'll come earlier. Okay. Thank you very much for your time.
Okay, thank you. So for the next board meeting, I still would like to have this contract issue explored a little bit further. I don't know who needs to get together beforehand, but Dr. Ta, I imagine you'd be involved, and Gino and council, whoever needs to be involved. Let's see where the holdups are with physician contracting. Sounds like there's a couple of different issues at least. And let's see if we can reach some streamlining and make some headway. It's something I've been hearing about for a while, so there seems to be an issue there. Let's see if we can get that ironed out. All right, thank you. Broward Health Medical Center, Dr. Morrison. Is Dr. Morrison here?
Yes.
I'm sorry, Jared, did you want to add anything on Coral Springs?
No, I'd be happy to answer any questions if you had on specific items that Dr. Zingaro mentioned.
All right, thank you. I think we're okay.
Okay.
Dr. Morrison.
Chairman Klein, Commissioners, Council, Leadership, welcome. This is our home hospital. Commissioner Wellens, this is your hospital because you are our leader here.
About that, but I think you've got a good leader now.
Right. And so having said that, I must thank you all for approving our new CEO.
and I think he'll be excellent. I don't know that he'll be able to fill our outgoing interim's shoes, but
How much did he pay you to say that?
You're really going to be missed around here, aren't you?
but
We'll have no problem.
he does make things happen. And having said that, Dr. Guy Ungaro had mentioned that there were issues with contracts, but in our case, in filling some of the gaps that we have had over the period of time, where it related to the orthopedics contract, ER coverage for internal medicine, and getting that done, he was able to make it happen. And that could only have happened with the help of council and all the steps that it took. So I have to thank them for working well with us here to filling those gaps. Having said that, there are other things that need to be done. And I would be remiss not to mention that one of the things that was mentioned by Dr. Guy Ungaro was that some physicians may not necessarily want to follow the PPUC patients, and part of it revolves around follow-up after. And so that is something that is another step that Mr. Santori is working on as far as getting the clinic follow-up and getting us a robust clinic setting, getting the whole thing done. So that is something that I have every confidence that when you move on, well, when you go to your other job, that you'll be able to make this happen. All right, let me see what else I should mention. We two other things really. We're going to be opening our new NICU, and I think you all have been invited, and that's going to be outstanding because that was an amazing job that they did. I should mention on a political note that one of our physicians who has been here for many years, Dr. Ron Gifler, has recently been promoted as the president-elect of the Florida Medical Association. And this is a noble cause. He will be covering the whole state. And as such, it's going to be great to have a voice, for many of the physicians, through Dr. Gifler. I just ask him to stand for 1 second. Having said that, the only thing I will close in saying that running this hospital and this system can be truly challenging. And along the way, we come across, stories that are sometimes almost like trials. And there's good and bad in some of these stories. And this relates to our transplant program. It's up and running. I think we did 2 livers this week. And so this is something that is positive. And I should tell you, in talking to Dr. Zingaro, he mentioned that he wasn't even aware, and he's a hepatologist, GI doctor, that the program that we were running here. So we continue to need to get the word out and to stabilize the program, make sure that those physicians that are on board, that we can find a way to keep them. We have some world-renowned physicians, and there are complications, but I have every confidence that if we put our heads together, we can come up with something. Truth be told, most times everything flows through our compliance department. So they are somebody that we'll look to see how can we sort these things out. I don't know how, but we will find a way. Thanks for your time. Thanks for coming to this great hospital. And it is truly the crown, the gem in this crown. Thank you.
Thank you, Dr. Morrison. And congratulations, Dr. Gibson. It's fantastic. It's quite an honor. So congratulations again. And I should note, I guess, Dr. Morrison, I'm glad to be back here. This was at this meeting last year. I was sworn in as a commissioner, so so it's my anniversary meeting. Quite a lot has happened since then. Interesting year. So let's move on to next item: medical staff credentialing update. Dr. Ta.
The details of the credentials report is in your packet under tab 6A, B, C, and D. System-wide, there was a total of 39 new physicians and 12 new allied health professionals with initial appointments. There were a total of 104 physicians and 32 allied health professionals for reappointments. There were 39 voluntary resignations and 0 involuntary resignations or suspensions. All appointments and reappointments were reviewed and approved by C&Q committee and at MEC at each facility in accordance with medical staff bylaws. There were no reportable events to the NPD or OIG or SAM exclusion reports. As far as committee appointments, Broward Health Medical Center added Dr. Karen Singer to the Utilization Review Committee. This concludes my report in regards to appointments for the medical staff. There is one other item that I need to discuss with the board regarding the core privilege form. The core privileges form were approved by the board last November. I reported here 2 months ago that we were going to implement the new core privileges form. During the implementation period, we found there were some errors and some opportunities to improve those forms before we continue to implement. I'm requesting permission from the board to revert back to the old privileges form until we, as medical staff, have the opportunity to review the core privileges form before we start the implementation process again. If you need some details of the challenges, I can give that as well.
What action does that require of the board? Is that something that we need?
Motion. I mean, if it were approved initially as part of, I believe Dr. Westfall had presented a number of documents, one of which I believe, as I recall, was the form. And so to the extent that was approved by the board, you would want a motion to, at least temporarily or until you bring a revised form back.
So it's not just one form, it's the privilege forms for all the specialties that we have at the health system. In reviewing the core privileges form, there were some privileges that were included in the core part that should not have been. So we need to review it and to make sure only core privileges are included in that section to make sure that physicians are credentialed and privileged accordingly.
Dr. Todd, the old form we used, you're comfortable with it? It's got everything on it that we need because we don't have it here. So are you comfortable with the old form?
Yes, I am.
Okay.
It's not ideal because, as again, it's standard practice is for the organization to move forward with core privileges for Joint Commission standards. But in my opinion, we have to do it correctly and efficiently.
And when do you think we'll have the new form ready?
We've implemented it since January of 2018.
No. When will you have the revised?
It's going to take at least 6 to 8 months.
6 to 8 months to revise the form?
To revise every single core privilege form.
So the form, so you said that you didn't like the form, so you're asking the board to go back to the old form. When will you be able to present a new form?
So 6 to 8 months to have all the forms reviewed.
What it is, just to explain it from a non-physician. So it's the core privileging form. So if I'm a general surgeon, for example, I come in this form, maybe 3-4 pages, and it says, here's the core privileges, and that will include, I can do it's not going to include laparoscopic, because not every general surgeon can do laparoscopic, but it's going to include, I can do an appendectomy, right, down the list. On the new form, for example, it may include things that are inappropriate, such as trauma surgery, as a core privilege. That should be an additional add.
No.
So every specialty has to be redone.
Right, so you think, I understand, so you think not how to correct it, you believe that it's going to take you 6 to 8 months to get every specialty's form where it needs to be up to snuff, so to speak. Okay.
What was the deficiency in the old forms that caused the creation of the new forms?
As the last Joint Commission, like I said, the Joint Commission standards is the best practices to go to core privileges. Core privileges are all the privileges that a specialist should do, all of them. And then underneath that should be special privileges that they request extra. So what happened, I was not part of the development process, but what happened was when the core privileges form were developed, some of the special privileges were included in core privileges inappropriately.
And do you anticipate rolling out all of the new revised forms at one time, or are you going to piecemeal them in as they're completed?
We're going to implement, once we have reviewed each specialty and review it with all the stakeholders approved by the board, we'll implement each specialty as we finish them.
Thank you.
I'm not a physician, obviously. So where I guess I'm having a little bit of a hard time is, why is this something that we're developing just on our own? I would think that there's some basic agreement that would be I mean, there's only so many procedures, there's only so many specialties, right? There's only so many core privileges for each one of these things. I don't know why, I'm not understanding why there isn't something a little more uniform through the industry.
But why reinvent the wheel? Why
Yeah, I feel like we are, and I don't want to do that, but I also don't want to just,
There are some templates
naive.
available for us to use as a guideline, and with the help of the chief of staff and the department chairs, we can use those standard templates and modify it to meet the needs of the organization. There are some templates out there available already, and we will start with that.
All right, so and I don't want to hold these things up, but is there a reason why we would go back to a form that we identified deficiencies with versus using a template form that might be the better pit stop until we get it finalized? Am I making sense?
You mean using the current?
It's got to be, because it's got to be tailored to the organization. So even the regular core form that we would look at without reinventing the wheel may not be appropriate for all of our facilities and specialties here. The reason why it's going to take so long is, yes, it's a lot of work, but it's because it has to go through the timeline process of going through each department, then go up through the medical committees, then come back here. That's why that timeline is extended. But to answer your question, the previous forms were not really an issue in terms of privileging people. It just wasn't best practice as recommended by Joint Commission.
That helps. You gotta have some people with privileges.
Right. So the old form has a laundry list. It starts like 4 pages of laundry list of privileges that each doctor has to check each off. So it's laborious, but it is what we have to work with right now. Okay. That's my recommendation for us to go back to the old form while we look at the new forms and revise it to make sure it is correct.
I just make a motion to allow them to go back to the old form pending the approval of the new form once it's done and complete.
Let's get past this. Second. The motion is made and seconded. I just have a question, just the executive team, and I guess the council as well, if you're comfortable with that, or if that raises any concerns in your mind with regard to going back to the prior form.
I'm comfortable with it. Given the alternative, I'm comfortable with it.
Okay.
I rely on Dr. Ta. If he's comfortable, then I'm comfortable. But it's not really a legal issue.
Again, and for today's purposes, Dr. Ta, are you satisfied? Well, I guess the motion is on the table. Why don't we, any further discussion on the motion? If not, all those in favor?
Aye.
Any opposed? All right, that motion carries. My follow-up question was with regard to the credentialing item that is on the agenda today. Is there any concern with approving the credentialing based on the form that's currently in use?
Not for this month, but for the past 7 months that we implemented this, we have to do a retrospective review to correct any errors that were done in the past 7 months.
So that in
January.
So you may be coming back before the board for re-credentialing approval?
Yes, sir.
Based on that, okay. All right, thank you. With that, I'll entertain a motion to approve the credentialing as proposed. So moved.
Second.
Okay, the motion made and seconded with regard to items 6A through 6D on the agenda. All those in favor, please say aye.
Aye.
Aye. Any opposed? Motion carries. Thank you, Dr. Ta. We're going to move on to the President CEO update.
Thank you,
Beverly
Chairman
Capazza.
Clyde. So earlier today, we had a detailed fiscal year 2009 budget discussion, as Commissioner Barry spoke to. The management team presented a comprehensive plan that strategically places Broward Health to continue to expand its services, enhance our quality of care, improve access, and reduce our reliance on taxpayer subsidy. In order to move the system forward, it is important to understand the state of the system upon my arrival in fiscal year 17. Broward Health had ended the year with a net loss from operations of $149 million, with a $20 million reduction from Medicaid funding. These two factors quickly set the tone for how my team and I would execute the first year of our 3-year strategic plan. Within 10 months, we identified over $31 million of savings. We refinanced debt and we improved operations, resulting in $15 million of savings, or a 10% improvement over the prior year. We kept patient care at the forefront of each decision and continue with key expansion projects, including the Broward Health North ER, the Coral Springs Tower expansion, and of course the Broward Health Medical Center NICU. We were dedicated to moving the system forward in a fiscally responsible, compliant manner. The management team, along with the Board of Commissioners, has been faced with complicated issues demanding difficult decisions. And we made sure that we maintained our services and quality, again, while lessening our dependence on taxpayer subsidy. Our efforts did result in a 15% decrease in the operating loss. We increased an operating margin of 1.1%. Have a projected $22 million improvement to the bottom line from 2017 to 2019, resulting in a 9.7 increase, which is inclusive of the $20 million in the Medicaid funding. I'm confident that our team has stayed true to our mission, ensuring the residents of our community have the access to the care they deserve. I want to go into a little, so I'm very proud of that, as you can see, because I also mentioned it at the financial committee. So well done, all the team in the audience, as well as my team here. They really were rock stars working on this. I'm very, very proud of them. As Gino alluded to, we have a centralized patient logistics, which is called teletracking. This system operates 24 hours a day, and I will tell you that the gentleman next to me was really instrumental in getting this. He came here with a focus. This was something he wanted to do. Already we have received a total of 204 transfers from 27 hospitals, and it's only taken us an average of 13 minutes to transfer a patient to the next level of care through this system. So that also is amazing. Well done. Under my quality pillar, I just found out that the Imperial Point Joint Commission was supposed to come back to do a resurvey. They looked at the results, and they decided not to come back. So it is official that Broward Health, all 5 of our hospitals, have been fully accredited for the next 3 years for Joint Commission, and that's also outstanding. So. Again, for people, we had Jonathan come up. Probably no one is more happier than Gino, so welcome, Jonathan. On our community outreach pillar, wanted to say that for the month of July, we touched over 11,000 lives with a total of 481 events. Just a couple of, I wanted to mention that Broward Health Coral Springs, and I met the police at the city of Coral Springs, the opiate task force. We're working together with them in the fire department and community activists to provide information, resources, and educational material to prevent overdose, death, and substance abuse. So kudos to Coral Springs. Recently, we did a drive for a back-to-school drive. We did it with CDTC. I know Chairman Klein, you were there. We serviced over 750 children and gave them backpacks and supplies to start the school year. And last but not least, we are all excited about the upcoming Step Out Walk to Stop Diabetes. The walk is on October 20th. Teams are assembling throughout the healthcare system. We have a goal to raise $35,000. We do have a competition with Memorial, right, Ellen? And we're close to reaching our goal. So again, kudos to everyone here. Did a good job. So thank you. That's my report.
Thank you, Beverly. We're going to move on to the consent agenda. I don't believe there's any items on the consent agenda.
Was the one from earlier, the recommendation from HR committee, the motion?
Okay, I must have been out of the room for that. What's the item for the consent agenda?
It's you have the. Do we have the
motion?
Motion, because it's a long motion.
I made it up, but I think I wrote it down.
That was Commissioner Berry's motion.
It was HR.
You might not need to remember.
What? That I remember.
I can't remember, but I'm sure I did.
Did you write it down?
While she's looking for that, I noticed that we have a couple of CEOs in the room. Why don't you stand up, be recognized? Alice, Gino, I'm sorry, Alan, Jared, Alice, and of course our new CEO. So thank you for being here, and thank you for the great work to continue to do.
So the motion that was eloquently stated by Commissioner Berry was that it was recommended to the board that Patty Alfaro, a board report, be elevated to an exempt position with a new job description, a budget, and the ability to hire an assistant, for her to hire an assistant. And it was unanimously approved at the HR committee. So if the board wants to make a motion to approve the consent agenda, you can do that.
I think we would need to add it to the consent agenda.
You can make a motion to put it on the consent agenda.
Is there a motion to add that as an item on the consent agenda?
So, I make that motion. Okay.
Second. Okay, motion made and seconded. All those in favor?
Aye.
Okay, item's been added. Is there any further discussion on the item? Well, I guess I'll entertain a motion to approve the consent agenda.
So moved.
Second.
Okay, motion made and seconded. Any discussion on the motion to approve the consent agenda? All those in favor?
Aye.
Any opposed? Motion carries. Items approved. Thank you. We'll now move on to the discussion agenda. Broward Health, item 7, Broward Health Coral Springs OBGYN ER call.
Mr. Commissioner Klein, I think Commissioner Gregor wanted to walk on an item on the discussion agenda, correct?
On the discussion agenda,
So
yes.
maybe we should entertain that
Do
first,
that first?
and get it numbered.
Certainly.
I'd like to walk on consideration of removing the word interim from Nigel Crook's position and make him permanent chief auditor. And if I need to put that in form of motion, I'll put that in form of motion.
Okay, so the motion to add an additional item is a walk-on to remove the title interim from interim internal auditor Nigel Crooks' title. Is that correct?
That is correct.
Okay, motion been made. Is there a second?
I'll second it.
Oh, all right, so so this is to add it to the agenda.
To add to the agenda.
Correct.
Any discussion on the item? All those in favor?
Aye.
Any opposed? Motion carries. Item's been added. Why don't we address that? Mr. Crooks is here. Why don't we address that as the next item? We'll make that, I guess, 7A and the next item 7B, so we can get that out of the way. Unless there's any objection to that? Okay. You're in charge. All right. So the agenda's been modified, so we've added now 7A. Mr. Nigel Crooks is, I guess the title for, to remove the interim tag from the interim chief internal auditor. Is there discussion of the subject?
So my rationale is we are nearly a complete team, and we seem to be finding out how to work successfully with each other. The only missing link is our chief internal auditor, because he's in an interim position, and yet he's held that interim position for, I think, 3 years, maybe something like that.
Not 3 years.
And he's successfully operated in that position. We've seen the audits that he's performed. We've seen how he's trying to fill up and turn around his department. And I think it's time to make him the permanent chief auditor, to the extent that anything in life is permanent.
That's an interesting motion.
Does that start, would that start, do we have a 90-day review period does it become new employee? How does that work? What is the mechanics of that?
Melanie?
Does he become essentially does his clock start from the time that he becomes permanent?
I know what we did with Nick. When we made Nick from interim to permanent, we backdated his start time to a certain point in time.
Yeah,
I know that.
Just because I presided over that. So in Nick's issue was a little different.
Okay.
He had remained at a compensation level that was not consistent with the chief compliance officer or even interim chief compliance officer. So when we made him the permanent chief compliance officer, we retroed his compensation to when he became interim. When Nigel was named interim, he received, if I'm correct, a compensation adjustment as well that took him back to even before he was officially named the interim. And so I think the issues are different. If we're speaking on the motion, and Nigel, I really don't want you to take this the wrong way, but he and I have had conversations. My preference would be for something like this to come to audit committee, number one, but more importantly, I'd like to see us get through this next audit from our external auditors as well. Additionally, I think it would be appropriate for us to have conducted our performance review as part of this consideration, as opposed to making it permanent prior to even having conducted the review. So my own personal opinion is I'm not in favor of the motion for those reasons, but it has nothing to do in particular with respect to confidence in Nigel or his performance, so I don't want that misconstrued. Well, at this point, I don't believe there's been a motion made.
I will make the motion to make Nigel Crooks
I thought it was on the
chief.
discussion. Well, now discussing the item, but I don't think there's been a formal motion.
Correct.
One way or the other.
Correct.
So the floor is still open. Vice Chairman Uri's spoken to the subject matter. We can continue to discuss the subject matter, or entertain a motion with regard to that. Certainly, good considerations have been raised. Commissioners, what are your feelings?
I've given you my feelings, and I made the motion to appoint Nigel Crooks as permanent chief internal auditor.
Okay, motion's been made. Is there a second?
I'll second it.
Okay, motion's been made and seconded. Further discussion on the motion. Commissioner?
Does my discussion count, or do I have
Yes.
to see myself?
No, you can.
I think he's been doing the job. He's in the role. He's reporting to the board. He has all the responsibilities. We're asking him to do everything that the permanent internal auditor should do. I don't know what else. If we were, if he wasn't doing the job, we wouldn't have made him intern a while back. I think he deserves the title and what comes with it. If we're going to review him whether he stays interim or permanent, it's not going to change the review process. I think he's earned the title. He's been in the job and doing it, and he's done everything we've asked him to do. We're asking a lot of him and more of it, so I think it's appropriate.
I think at this point, I'd like to ask Mr. Crooks to come up and just speak to your background and experience. I know we've met and you've run through that in your background. How long you've been doing this? Just really in a nutshell, give us an overview.
Yeah, so just an overview. I have over 15 years of internal audit experience. I've worked for major corporations, including that of Deutsche Post, which I've taken a position as a VP of internal audit in Europe. I've run the gamut from Europe and in Asia to doing audits, supervising audits, directing audits. I came to Broward Health and now been 3 years, almost 4 years. I have a myriad of certifications, including the CIA Chief Fraud Examiner and Chief Risk Manager. And so I'm very much qualified. I have an MBA, so I fit the both qualification in certification, education, and also experience. So I think I'm capable of running the department. I've shown that for a number of years. I've worked in the department for at least 1 year. So I have the experience. I've worked with all the managers here and provide all the board reports, my audits, and went over them in detail as to what I've done. So I think I'm pretty much capable of doing the work. And also I've done the work. So.
For what period of time have you served as the interim chief internal auditor?
I've been in that position of almost a year, but prior to that, as Commissioner Uri alluded to, I was working in the position, so it's actually 2 years without being paid. That's why they had to backdate. So I took the gamut and run the department when the chief auditor left the department, and so given that I'm doing work for almost 2 years.
Well, you were in the role without being the interim during the last audit, correct?
Yes. I was asked all the bailiwick of that job to do the bailiwick of that job before I was appointed interim. And after I appointed interim, I was still doing work as well. So presented the audits, conducted the audits. So it's, slowly.
But you were in this role during the last outside audit that we completed.
Yes.
Correct. You were running the department without the title at the time.
Right, exactly.
Okay. And I don't recall us having any issues getting the work done.
And we've relied on those audits all
We
along.
relied on that outside audit and his work. I don't see there's a problem. I think it's the right move at this point.
Commissioner Barry, do you have any comments on the motion?
Just, there are 4 board reports, and there should be 7 board members, so you'll be intensely supervised. I saw what you have to do. It's enormous. When the budget and we approve everything in the next couple of weeks, you need to say what you need to do the job. It's I'm not going to sit here 6 months from now and miss something and be kind about it. So I think you need to come back when we asked you to earlier today with a real budget, with real needs, telling us what it takes to do that job that I saw, which looks really intense to me. Because at this point, you'll be held completely responsible for the performance of that unit.
My feeling is, we need to streamline and in some cases formulate procedures for the board. We keep recognizing deficiencies. I think this is an area where we haven't necessarily had the annual reviews of the direct reports or the criteria for the annual reviews. I think we're working towards that. That being said, we have a need for a chief internal auditor, and you've been filling that role, and I think doing a very good job in that role. I've reviewed the audits that have been conducted, so I'm in favor of bringing you on as the chief internal auditor without the interim title. I think it's something that we need to do. It's an important role. We need to obviously have you here and have you expanding your team because it's a very critical component of what we need to do as a system to continue to review and identify issues. So
And my last thing is I'm expecting Commissioner Uri, because I believe internal audit is yours, to really be kind of on top of this and to be very clear about the expectations. We don't do a great job, I think, of being very clear with our direct reports, and I think we're moving to change that. So Commissioner Uri, it's going to hopefully be on you a little bit to help us with this process. It's a big job. It's complicated.
I've said that many times. And your comments certainly well taken. Is there any further discussion on the motion? If not, all those in favor, please say aye.
Aye.
Any opposed? Okay, the motion passes 4-1. Congratulations. I can move on to item 7B, which is Broward Health Coral Springs OBGYN ER call.
Thank you, Commissioner Fine. Before I go through the next 3 exhibits, because they're all related to the same thing, I wanted to ask the board for a favor. I'm working closely with Nick Hartfield and Lynn eventually to redo a policy. And the policy speaks to basically our process around focused arrangements and probably a slew of other things, right, Lynn? But in that policy, there's a small section that states that any focused arrangement contract, particularly with a physician, that's above the 75th percentile needs to come to the board for approval prior to executing it. I know this is going to be shocking to you, not comfortable breaking the rules, and there is a policy that says that. At the same time, in unexpected circumstances, or if the board's not going to meet, or if we run into a major situation and God forbid, a couple of physicians pass away and we have to get someone else to take call, we're responsible to provide coverage here. Until we get this new policy done, I was hoping that the board might be able to make some type of motion that gives us authority to enter into these agreements in a scenario like that, clearly subject to compliance and legal review prior to us doing it. And I would bring them, like I'm doing right now, to the next board meeting. All of our contracts have out for convenience in them. If something ever didn't, if we missed it, and legal missed it, and compliance missed it, or the board just doesn't want to do it for some reason, we could always do an out. But I'm really not comfortable having to make this call, and I don't think that any of my colleagues are comfortable with it either. And you could tell from my one-on-one briefings that I was not comfortable doing it, but the lesser of two evils in this scenario, we really didn't have much of a choice. Is that something that could be made via a motion?
Are you asking for permission in the event of an emergency situation? You wake up tomorrow and we've got no call, and neurology, and you have to hire somebody. It's above the 75th percentile. It's got to come to the board. Are you asking for open-ended, or are you asking for some cap on what you could approve in an emergency situation prior to a board meeting?
I'm asking for approval to go above the 75th, but still it has to be fair market value, obviously. So if I don't have a fair market value or commercial reasonableness report, I wouldn't be able to do it. But I'm asking for approval to do that prior to coming to the board,
right? And
would always bring it to the board immediately after. And I don't want to ever have to do it, but the world that we're living in right now, when we're correcting all these contracts and converting every single specialty call agreement, there's a few scenarios where they're going to come up.
So what does our out look like? Let's assume you wake up tomorrow, you find out you've got an emergency situation, you need to sign a contract. Our board meeting's not going to be till another 25 days, and you bring somebody on above the 75th percentile, and we ultimately decide no.
Yeah. There's a couple of different ways to get out. One, if it's for cause, so for some reason it wasn't fair market value, that's immediate out. But no.
Oh, no, I'm saying we wouldn't.
Oh, right, it would never happen.
If it's not fair market value,
Right.
so that would never
It would
happen.
never get executed.
Right,
but-
so, right.
And then there's an out for convenience, depending on the type of contract. The longest one is 90 days.
So we could theoretically have to.
Employment? So a lot of our employments are 120.
120, Beth? It is 120, I'm
Yeah.
sorry.
So we would have to live with that contract for a period of 120 days if the board decided ultimately it wasn't what the rate where we wanted to go.
Yes. And the solace in that is that if me and Alan and Bev and Nick and Lynn all agree on something, there's a slim chance, in my opinion, that I think the board would say that's completely off
So
base for these
these
agreements.
contracts would have gone through the remainder of the process. They would have gone through the proper contract.
Absolutely.
And simply not have yet come to us.
Absolutely.
Because there's no board meeting or board meeting got canceled or.
It's in quarantine, we have to take care of patients, right? So if we need the service, we can't wait. We have a ER call, we need to get it, we can't wait. We need to take care of the patients, and that's what it's at.
And the only reason I'm asking for this now is because the policy that it's in has significant other changes that are going to take some more time. And I don't want to have to do this again for another month. I don't want
But
to come
as
here
you
and say I
say,
did
if
it.
it's gone through the entire contracting process successfully and everyone agrees it's an appropriate and necessary contract,
Yeah.
it's highly unlikely that we would say, no, it's not.
What step would be missing other than just us ratifying
That's
it?
it. Mhm.
So legal would sign off, you would sign off. CEO
Nothing
would be
is,
comfortable?
everything is gonna be the same, except the fact that usually before we enter into the agreement, we bring it to the board approves it, and then we sign it, because it's already been through the CGC process, legal compliance, final compliance review, ethics, blah, 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 has already approved, so.
Does the general counsel, do you have any qualms about this?
No, I'm just trying to write the motion.
Is
To,
Nick here?
the only thing I would say though is that it has to be, as Gino and I have worked on, exigent circumstances.
Yeah.
That it's not that somebody forgot and now they're trying to, let the time lapse and that's the last day.
And Lynn
It's
and
not-
Nick won't let me get away with that.
That's gonna be a judgment, that
It is
essentially
gonna be-
becomes a judgment call.
It is.
Yes.
So where we've experienced it for these few would be, we thought we had a deal. The doctors then say, we're not gonna do it for that. And now we have a gap in coverage. Or a physician employee, potential employee says, there's a new set of outside interests that we have to do ethics review, but the gap is gonna come and Laura Ellis doesn't want any holdovers. So we would try to extend something, but it may have already been at the 90th or it's brand new. So the intention is that it's gonna be rare and that it's necessary for patient care and continuation of care, and provided that it's gone through the entire 360 process and gotten all approvals.
I would only suggest that we put an absolute cap at 100%.
Yeah, I think that's fair.
I don't think we've ever been there.
Well,
A little above the 90.
yeah, because
Okay.
the only issue is that so we have one right now that, and Lynn, you can speak to this better, but sometimes the fair market value comes back and it says at or above the 90th percentile. So I have seen them. So there is one. The old FMV showed it at 117%, but the new FMVs that are coming back show it, the way that they report it says at or above the 90th percentile.
Okay. All right. So maybe I'll take the cap on this. I would suggest that I would be okay as long as Nick, Bev, and Lynn Barrett, if in the case that happens, all three of you sign a memo saying, we all agreed, we've approved this, so that all three of you have talked about it and approved it, and there's a document that says that you guys met, and that
And
would
it is
be
an emergency.
correct, because that's really would be the three board reports that ultimately would report to us. I think this is not an internal audit issue, so I think compliance, general counsel, and CEO, if emergency comes up, you guys sign a document that we've agreed, we got to do it, boom, and then bring it to us. I would be comfortable with that, and I wouldn't really want to put any other restrictions, because I think if that's the case, we would cover our bases.
And also that'd be obviously brought to the next board meeting.
100%.
Subsequent, immediately subsequent board meeting.
So do we need a motion?
We do.
Okay, so I've finished. Well, it's kind of long. So the motion would be that Broward Health may enter into contracts for physician services where the compensation is equal to or above the 75th percentile without prior board approval, so long as there are exigent circumstances affecting the delivery of patient care. The arrangement has properly gone through the entire 360 process and have received all approvals, and a memo is prepared and signed by the CEO, the General Counsel, and the Chief Compliance Officer supporting the approval, and that the contract is immediately brought to the next board meeting.
I make that motion. I'm not repeating it though.
A second.
Okay, the motion is made and seconded. Is there further discussion on the motion?
Was that everything?
If not, all those in favor, please say aye.
Aye.
Aye. Any opposed? Motion carries.
Thank you, board. Thank you, Lynn.
So no more 2 o'clock in the morning phone calls from you?
I might still call you.
Just as a warning, we have 23 minutes before we have to adjourn.
All right,
Okay.
I'm gonna fly through this. Okay, so agenda item 7, this is for Broward Health Coral Springs, OBGYN ER call. That we're seeking approval at or above, this was an example I was giving, the 90th percentile for call. We went through an exhaustive process to try to come to anyone who would accept something less. In fact, the team at Springs reached out to 32 different providers 2 times separately. We went back and forth with the FMP company. It took a lot to get to this. We have a group that's willing to cover it, and we actually do have an action plan moving forward on how we can mitigate the risk and burden of this call in the future. So what we're asking for is, therefore, it is requested that the Board of Commissioners of the North Broward Hospital District authorize the President and CEO to approve the obstetrics and gynecology emergency room call coverage rate at or above the 90th percentile rate.
When you say above, that could go directly to 100.
So it's weird. So the dollar amount, which we don't put in this, but the dollar amount is already set, and PYA determined that dollar amount to be at or above the 90th percentile. That's why it's a little bit confusing. That is the rate.
Specialties in the surveys, they don't go above the 90th. But
So they approved the dollar amount, they just didn't tell you where it fits overnight.
Correct.
So right, it's over 90,
Correct.
could be 110, could be 95.
Right.
Do you need a motion for that? Are you gonna do one altogether?
I just need a motion to approve that staff recommendation.
Second.
Motion made and seconded. Any further discussion on the motion? If not, all those in favor?
Aye.
Any opposed?
Gina, could I
Motion
interrupt
carries.
one
Yeah,
second? So just also to explain to the board that for these types of arrangements, legal and compliance have now instituted a process, an excruciating process, some would say, where they have to, the CEOs in particular, have to state all their efforts to obtain the service. So in this case, it was 32 OB/GYNs. When they talked to them, what they said, what was the rate, what was the rejection, and then they have to say what are their alternatives, so locum tenens, laborist model, and then we've actually also added how long is this going to last, and so what are you going to do to make this an alternative, another alternative, and a time frame. And that's all put in a memo, and it's uploaded into 360, so that if the IRO or the monitor looks at why is this at the 90th, it's all laid out in a memo form.
Move on to the next agenda
Yes,
item.
please.
Okay.
Thank you.
So the next one is for Emergency Department Trauma Services on-call coverage at Broward Health North. This exhibit covers both neurosurgery and orthopedic surgery for the trauma services. The neurosurgery on-call services comes in at the 90th percentile, and the orthopedics comes in at the 88th percentile. Of note, those are both using national benchmark versus regional, which we typically use. In this case, that's because it's trauma and there's not that many respondents in that area. So when there's a low amount of respondents, we typically use the national benchmark number. So the other thing of note here is that there were only 2 providers in orthotrauma and 2 providers in neurosurgery taking 100% of the call at this facility. So the burden was pretty intense and remains remains so. So the staff recommendation here is therefore it is requested that the Board of Commissioners of the North Broward Hospital District authorize the President CEO to enter into contractual agreements for neurological surgery on-call services at the 90th percentile and orthopedic surgery on-call services at the 88th percentile.
So moved.
Motion is made. Is there a second? Second. Motion's been made and seconded to adopt the recommendation. Any further discussion?
I actually have some questions here. I have some concerns about the process. This happens when you have, and you and I talked about this in the briefing, when you have, let's say, two doctors working at it that we're negotiating with that are currently on staff and we're trying to hire additional, and the two that are on staff that we're trying to rid of are refusing the lower rate and refusing the lower rate, and then you go outside and bring somebody else in who agrees to a rate above where those doctors, and all of a sudden they drop their demands. I think there's a question there as to how that market is being priced. And I think that's something we want to be very careful. I actually think there's a statute in Florida that deals with potential collusion in pricing of that, price fixing. And I think we want to be very careful. I don't think it's something that we would be doing. I'm saying, what are our protections that are protecting us from the physician's price fixing on the other end, where we could have a regulatory issue?
So I can actually speak to that in most instances. As an example, I believe it was ortho at medical center, right, Lynn, where we reached out to all of them, and be that process that she was just explaining, where we reach out to each individual and ask, are you not going to take it? What rate would you take? The range that came back for them was actually significantly different. Each one had a very different range. So in that scenario, it's evidence that they're not price fixing. Now, in this particular scenario that you happen to bring up, there's only two providers and they're in the same group. So you're right, it's very hard to protect against that. What I will say is that on both of these specialties at North, because of our inability to get additional people to take it, and because the alternatives were either locums, which will be more expensive, or employment, which takes a while, we are going down the route of employing in these specialties now. Because to your point, we don't want to be in the scenario where we're having to pay the 90th percentile in these specialties. If it's that burdensome, we want to be able to secure the coverage as a trauma center, so we're going to have to go down the road of employment.
Okay, and General Counsel, are you comfortable with that? That's doing the best we can to mitigate our risk there? I mean, in a perfect scenario, we can't control what somebody else does behind the closed door that we don't have access to. We can't look into somebody's mind or view their conversations.
Right.
But are we doing everything we can to mitigate our risk from a risk management standpoint? Not saying that we've done anything here, and it's not so much about ratifying this. It's going forward.
There is one other thing that's helped us out, and I thank the board for this, because in the past, when you look at past practice, and it's kind of uncomfortable to talk about this in the public, but here we are. So in past practice, we have seen many specialties when their call rate was up due, that it became a theme where they would go and have the hospital be without coverage for several days, and then several days later the rate goes up. Because the board authorized us to allow us to get locums, that has really curbed that practice. Because we are in the process of, we can't find someone to do it at a rate that is fair market value, because there's been scenarios where they hold out and we just can't get a fair market value for it, no matter how much we want to pay them. So in those scenarios, we're getting locums and we're going down the road of expressly employing in that specialty. So that's one piece of leverage that we didn't have a few years ago, and we do have now, thanks to the
That
board.
cuts both ways, so.
It certainly
It's
does.
more expensive than.
Oh yeah, it hurts in the beginning.
It always hurts.
It does help with leverage, but it cuts both ways.
So contracts like these, if you are able during the term of this contract to employ a physician in this specialty, how are these contracts voided?
So per our call policy, this contract, we have an out for convenience, which is on the call agreements, I think is 90 days. But notwithstanding that, the contract doesn't guarantee them call days. So in our on-call policy that was board approved, If we have enough employed physicians in a particular specialty to cover the call without the need of opening it, that's correct.
Okay, so we're
And
comfortable
right,
that we're
so-
doing all we can to mitigate risk.
I think that what the issue is that we have to, that Gino and I are talking about is when we ask for the rates, there is a statute in Florida that is I believe it's a criminal statute on conspiracy to get together to withhold call coverage. And we, when I was at another health facility, we actually went and met with the AG's office because it was very clear that physicians were coming together to price fix, as you would call it, but it's not what it's called, and it's specific for call. And so we will be, we look at that now, particularly with some of these that were high. And the question became, did people come together? So we are looking at that on some of the call arrangements, because there is a specific statute in Florida on it.
And you will continue to communicate and work
Right.
that out. Okay, all right, okay.
And just generally speaking, along those lines, we talked in the past about recruiting efforts relative to nursing to reduce our hourly staffing, our agency staffing. I imagine there's similar efforts being made on the physician side to recruit the physicians we need. Hopefully, as we continue to fix things within the system, that'll become easier and we get things ironed out. But certainly that's something I know is happening to help reduce the need for locums and these types of on-call arrangements.
There's a couple of physicians that we're using locums for right now that are moving through the employment process as we speak, so they're moving pretty quick. Thank God.
And a typical employed physician contract is how long? Year, 2 years?
2 years.
2 years.
Yeah.
Okay, so if we go to move to an employee, it'll be a 2-year contract, so we have some stability. We do that. Okay.
Excellent, thank you. All right, so
was that approved or was that?
No, there's I don't believe there was a motion made.
And it was seconded.
And it was seconded.
So I was just going to vote on it.
All those in favor?
Aye.
Aye. Any opposed? Motion carries. Okay. Next item, I believe is yours also, Gino?
Yeah, yes, thank you. This one is for a pediatric GI physician. This is approval to enter into a new two-year agreement at the 90th percentile with Dr. Duro for pediatric GI services. The interesting thing on this one is the last FMV showed it at the 117th percentile, and so regional was 80th. So we actually reduced this from the previous contract, thinking we'd be even less than the 80th, but as it turns out, the new FMV places the lesser amount at the 90th percentile of both regional and national. So that's where it's at. A little bit about this physician. She's very unique in the sense that there's not many pediatric nutrition intestinal rehab services around. So what she does is very special. The alternative to having this program is to do a bowel resection on these pediatric patients, and ultimately they would end up with either a colostomy bag for a little while or permanently. So this is actually proactively addressing the diseases and being able to address it from a nutritional standpoint, avoiding the invasive surgical procedure. So it's really a good thing. She actually learned from the premier center where they did this at Mass General, which is part of Harvard. And we actually get the shortcut program attracts a lot of patients from everywhere to come for that specialized service. So I think it's an important thing for the health system to have. Staff recommendation. Therefore, it is requested that the Board of Commissioners of the North Broward Hospital District authorize the President and CEO to enter into a new 2-year agreement with Dr. Deborah Duro for pediatric gastroenterology services at the 90th national and regional percentiles.
Is there a motion to approve? There's been a motion to accept the recommendation.
So, second.
Second. Any further discussion on the motion? All those in favor?
Aye.
Any opposed? Motion carries.
Mr. Chairman, may I also, I think in Finance Committee, there's another walk-on or on the agenda, which was the shade session, because it was done at a committee and not at the board. And you had mentioned another strategic meeting that you wanted to hold. So before we get through the rest, I think there's another walk-on, at least from the consent agenda. I don't know if it was unanimous. I just wanted to say that before we finish this part.
Yeah, maybe we should do that, and then we'll be right at 5:30. We must
Can't,
break,
it's at a committee meeting.
and
It
then
has to
take
be
up the
approved by
last
board.
forum after the tax hearing.
I asked for the shade, and Commissioner Berry asked for a strategic, or is going to ask.
For a strategic.
So maybe that you want to walk that on now.
Well, why don't we see, why don't we see if we can get through the next item. We do have to temporarily adjourn this meeting to conduct our tax hearing, the first tax hearing at 5:30 p.m. sharp. We have 9 minutes to do that. Is it possible we can get through item 11?
I think we
we
could probably get through 10 and 11 in 9 minutes.
All right, why don't we do that first? We'll adjourn this meeting, reconvene, and add those items that need to be added.
Okay.
Thank you.
Item number 10 is an easy one. This is every single, well, we've had this for the past several years. It's for primary health care services in the county. The annual contract amount is $8,495,420 to be paid in monthly installments beginning October 1st, 2018. And there's 4 options for 1-year renewals. It's flat funding from current year, so there's no change there. It is budgeted in our 19 budget, and it's part of our CHS. It's not really a grant, it's actually considered funding, so you won't see it on the grant budget line, but it does roll up under funding. And we did get all $8.4 million in the current year, and we're expecting it in the next year as well. They do about 94,000 visits in CHS, and this is a big component of it. That's roughly half of the funding, actually. So the staff recommendation here, therefore, it is requested that the Board of Commissioners of the North Broward Hospital District authorize the President and CEO to execute a contract between Broward County and Broward Health for the continuation of primary health care services for the period of October 1, 2018 through September 30th, 2019.
Is there a motion to accept the staff recommendation?
So moved.
Second.
Motion been made and seconded. Any discussion or questions on the item? If not, all of
Just one question. I understand that the county pays Broward Health to provide this service.
That's correct.
Okay, thanks.
That's correct.
So they pay us, and then we're allocating the funds.
Yes.
For services.
We actually provide the service.
It's a reimbursement?
Yeah, it's
we provide the service, they reimburse us for the service.
That's correct. Yes.
It's at a contractual rate for each, whatever the service is based on. Okay.
Yes. We have.
Okay, any further questions or discussion? Not all those in favor, please say aye.
Aye.
Aye. Any opposed? Motion carries. Let's see if we can get through item 11.
Quick. So this one is for marketing of hospital services, inclusive but not limited to cardiology, orthopedics, oncology, women's, and bariatric services. We do have a marketing plan which goes over this specific component that perhaps we could either do individual board briefings or, if appropriate, in the strategic shade session. But if you remember, those of you who were here in November 2017, we identified that our digital media contract had lapsed, and they being the facility were continuing to use them. So I brought, even though it was budgeted, I brought to the board, in the spirit of transparency, the settlement agreement, which was for about $500,000, so that we can close out that contract. I also told the board at that time I was going to do an RFP so that we could replace that service. So we did an RFP. Here we are today. The winner of it was Evoc Advertising. The budgeted amount was $700,000 per year. The term is for 2 years. This is only for digital and radio advertising, so it's not for anything else, branding work or anything like that. There were, in my individual briefings, there was some concern around, we have a lot of stuff going on in terms of litigation with certain marketing companies here at Broward Health. Digital media was not one of them, but if we had to, look, we haven't had services since November 2017, so if it has to go to September, I can answer any questions between now and then. I just wanted to present it and get the board comfortable. If they're ready to move, great. If they're not, I can get whatever collective questions the board has and then bring it back next time.
Is this a local company?
Actually, don't know. Denise? Lake Mary.
Is it a small business entity? Do you know that, Glenn?
I do not.
Can you come to the microphone, please? Thank you.
1 minute.
I'll be quick.
Denise
Just in case you
Moore.
have any questions. I'm Denise Moore. I'm the VP of Marketing and Corporate Communications. In case you have any questions.
I personally, and I think I shared this with you, Gino, that I thought since some of this is strategic, and individual briefings would be appropriate here before I would be comfortable voting on it. I want to understand what we're trying to do here, what the plan is, and I'm sure it's the right thing to do. We're talking about a lot of money in an area where I at least for me, I haven't heard about this since November last year, and it's the first time I've seen it. So I would prefer us to come back either at the end of September or in the October meeting and bring this for a vote when we've had at least an opportunity to be briefed on it, see the plan, see what they're planning on doing. That's my perspective.
But you RFP'd this, right? This was an RFP?
Yeah.
And it's budgeted in the 19 budget as well.
But you had indicated that there was an issue of timing that's not critical, Gino?
Well,
that,
I'm saying we haven't advertised in digital media since November of 2017, so
Yeah,
it's
we
been a
have
long
no
time.
Google
It's-
search.
I mean,
We are
it's-
not able to boost any of
not
our
critical.
social media.
It is
We are-
embarrassing. It's not critical.
Yeah, I mean, we've been hearing today about our investments in robotics, our investments in our expansion of our NICUs. We don't have the ability to advertise on any digital media right now, nor are we boosting any of our social media posts. Everything is organic, so we're reaching, less than 10% of our audience on social media. So we are very restricted as we continue to invest in these expansions. We're restricted on how we're able to reach the audience.
Yeah, I mean, personally, I think digital media is critical, and I think our digital media is horrible for the reasons that have been described. And we essentially have no push. We have no presence because we don't have a vendor that's doing that for us. And everything is organic. We've had that discussion. I know several of us have had that discussion. So to me, it's a critical need. That being said, we are meeting in 2 weeks. So if we want to take the extra 2 weeks, and perhaps more information could be provided to the commissioners to make us more comfortable with regard to what this company is going to do, how they're going to do it. This is obviously just very limited information. Perhaps that makes sense to get that additional information and revisit it on September 26th.
I think I think 2 weeks would be plenty of time for you to get us all comfortable, get us whatever materials, and have this ready to go at the end of September, one way or the other. I don't think that there's any reason why it would take longer than 2 weeks for you to brief the 5 of us that have an interest.
I have it, and I'm just ready to brief. I just don't. It's a lot of it's strategic, so I think we're prepared to.
Okay.
I don't think 2 weeks will be a problem.
Okay.
All right, thank you. All right, at this point, it's 5:29. We do have to convene the tax hearing at 5:30. I'll entertain a motion to temporarily adjourn the board meeting to be resumed following the conclusion of the tax hearing. I'm sorry, to recess the board meeting.
So moved. I'll second.
Motion made and seconded. All those in favor?
Aye.
Aye. Okay, we stand in recess as a board. All right, at this point, I'd like to call the board meeting that was previously recessed back to order. This is the board meeting of North Broward Hospital District Board of Commissioners. We're on to item 12, clarification of board interference. And Lynn's gonna give us an update on where we are.
Right, so we're in the process of preparing guidance on interference versus can't hear me? That's the first. Interference versus operations.
Okay.
And then we'll bring that as soon as it's done back to the board to discuss.
And you mean that's guidelines for what we are permitted to do and what we are not permitted to do?
Right, but just to manage the expectations, there isn't a lot out there. There is an Attorney General opinion that actually was requested by Sam Gorin, the former General Counsel of the North District. And there's very little, so it's not going to be, you can do this or you could do that. And we had an issue where another commissioner was accused, and we just had to make the determination that the accusation was ridiculous. But the guidance is not, there's not a lot of guidance from the Attorney General standpoint or case law, but we're working on it.
Okay, so that will be brought at a future board meeting.
Correct.
For further discussion. Okay, thank you, Lynn.
You're welcome.
Next item is community care plan discussion, item 13, A through D. And I'll just note that we have several other items, so we do need to make sure we stay on pace here. We've got at least 6 more items after that, walk-ons. So community care plan discussion?
Well, I asked for this agenda item to be put on, but I'm more of a statement, and then I'm going to ask the folks from community care plan and possibly Ms. Capasso, I'm not sure who would be best to talk about the items we need. For those of you that aren't really involved in it, the community care organization is a partner of ours, a 50-50 partner, I believe. It's a source of clients and it's a source of revenue. It's been a source of profit. We are a partner with them, and from all indications, I'm not sure that we're a good partner. We take a long time to make decisions. One of the first meetings I was here, we were tasked with trying to get some of these accomplished. These same exact items have been on our list again and again. I know the South Broward District, who is our partner, isn't thrilled. But my view on this is a business essentially that we are a shareholder in. It's been a profitable business that we are a shareholder in that helps us provide the care for the people that we provide care for in Broward County. It has a legal counsel. It has an administrative staff. It has everything that it needs to operate without us. We're a shareholder. I'm personally a shareholder in a lot of companies, including through stock I own in Apple and others, but I get no say in what goes on in those companies. We have a lot of say, obviously, in this, but I think our board member is Ms. Capasso. Is that correct? She is the representative of us in this organization. The South Broward Hospital District has an attorney that's a legal counsel. We have Ms. Barrett, that's legal counsel. I believe CCP has an attorney. If you can get all 3 of them to agree to one thing, I would be shocked. So we need to make some decisions. We take too long to decide on what to do. We are, in my opinion, dragging this thing down. We either need to get these things done, trust that the organization that we've co-funded with the South Broward District is operating appropriately with the right legal counsel and with the right administrative staff, and move on. There are 4, 5, or 6 things that they need us to decide. I think some are urgent and some are not. So with that, I'm going to ask Ms. Capasso or whoever from our organization to tell us what they need, see if we can come to decisions, and if we can't, and we can't push this along, we need to think of alternatives as to how to move forward with this company. We do not want to keep hindering it.
Okay. Before I dive into what the items are, and there are 6 items, one of them is listed as number 14. Anyway, there's 3 of them I think that we need to move on quickly, and if we don't vote on it today, we should vote on it on the 26th to be able to give an answer back. But before I get into it, I think we should talk about the process, right? So the board created a special committee, which Commissioner Barry and Commissioner Wellens are on. We had the first special CCP board meeting where they went to CCP and we went through kind of the history, where we're at, and then also going forward, what are the 6 ticket items that would need action, yes or no, moving forward. Of those 6, really 3 are critical from a timing perspective because we've applied, and if we happen to get the business, we need to be able to make a decision to move forward. So I think the process should be that the special committee has their meeting with CCP, then they come back to the board and kind of present what those items are. In the interim, because this is a lot of information, I think it would benefit also from a board briefing, which we could do individual board briefings on. Part of the challenge with CCP is, and I empathize with compliance and legal on this component, is because we're asking for, and actually the board is looking to legal and compliance to say, is it legal and compliant, right? We can explain it operationally, that's an easy decision. The issue is, we don't have a draft of some of these arrangements yet, right? And the reason for that is we didn't get awarded it. So to give an answer of is it legal or compliant, they need to see a document memorialized to say, is it legal or compliant? So that's part of the problem that we're in. So I think as the board may want to consider this moving forward, when you have a comfort level from an operational standpoint, unless it's something that may have to do with a current ongoing FTC investigation or something like that, I would think maybe the board could give approval from an operations perspective, subject to legal and compliance. Because if it's not legal and compliance, we're not gonna do it. We obviously wouldn't support that either. With that said, since we're limited on time, let me just tell you what these are.
Could I just interrupt 1 second? I apologize. So the process, though, has not been followed for these items, because after the meeting with CCP, the special committee is supposed to get together to discuss, the two of you, go through all the items, get all the documentation, whatever is needed, and then make a recommendation to the board. So just know that it's violative of the process that this board put in place to vote on these today, without the special committee having met. And you wouldn't have talked to each other after the CCP meeting, which was the first baseline meeting informational.
I don't know where it says that we have to meet after we met with CCP. Where does it say that?
It was in the process that was determined.
But that's in a motion somewhere then, right?
It is.
So can we find that? Because I don't think that step is necessary.
It was supposed to be that there would be a recommendation from the special committee on what actions to move on, what not to move on from a strategic standpoint, and those recommendations would be fully vetted by the special committee, and then a recommendation to the full board.
This half of the special committee fully vetted them and believes that we should move forward with them.
It was to be
Commissioner
an open
Wellens,
discussion.
well, let's talk about it. We need to do something. We need to get this done. Commissioner Wellens, I believe it's up to you to look at these and see if you're comfortable with them, so that you can make a recommendation with me to the board that we move on these items.
And also, CCP is in the audience, so if you have any questions, they certainly are here to answer any questions that you might have.
I have a concern that we're setting up an additional process. We have a company that is operated by people that I've known for a long time that I think do a really good job, and we're making them jump through extra hoops to move on things that they probably need to move a little quicker on than we're able to move through this process. If this in fact is the appropriate process, I don't understand the impediments. I do not believe by any stretch of the imagination that any of these items are inappropriate, illegal, or anything along those lines. So what's the stopping for? And that's my concern. I know the South District is really frustrated with us as a partner. I know that there's been some, I don't want to call them threats, but I would imagine this would end up in a shareholder derivative action if that's appropriate. It's got to be something. If one shareholder, if you have a 50-50 deadlock, I believe that gets done through a derivative.
No.
Well, mediation, and what if that doesn't work?
Well, we're not a company. We're not shareholders. It's a member organization, and it's controlled by the operating agreement.
Right, so whatever it is ends up in mediation, we end up fighting. If we can't move on this, we need to get out of it. We need to sell it, get out of the way, do whatever. I know you don't want to, but we can't keep tripping over ourselves on this side of the ball. If we ended up in mediation, I'd imagine we wouldn't fare so well in that. We've had a lot of opportunities to kind of do what we need to do. And I get general counsel's trying to protect us from ourselves. I understand what you're trying to do, Ms. Barrett. The issue with this is none of these things appear to be, from my view and my experience, problems. And I'm not an attorney, so this is my own personal view. My career, my business, my life is dealing with hospitals and managed care companies. Both of these two entities. I understand both of them. I understand how they're supposed to work. I don't see any problems in this, and I think we need to move one way or the other. If we can't, it's fine. If our process is that burdensome because we have all these other issues, let's figure out how to get out of the way so that we're not holding back the other side.
Well, is there a way, let me ask you a question. I mean, is there a way for us to proceed on this, knowing that there's the two members of the special committee are here, this is a noticed meeting, assuming they concur, we have a recommendation from the special committee of the two commissioners. And with that, it would appear to be appropriate that the full board can consider that recommendation from that special committee subject to legal review of the agreements once they're finalized. So we adopt things on the agenda all the time, subject to satisfactory legal form and review by council, is it not feasible that we can follow that same approach here, saying we adopt the recommendations from the special committee, subject to compliant contractual arrangements and satisfactory review by our council, assuming awarding after protest, entry into the local agreement, et cetera, whatever needs to be done subsequent to our approval. So in reverse order, it seems the first thing that has to happen is we have to say yes, then there has to be some efforts being made to enter into these agreements, or at least get the bid or get the award, and then execution of the contracts. Those things don't seem insurmountable to me. So there has to be a way to get this done. We just need to find a way to do it.
Could we hear from Commissioner Wellens? You were the other member of the special committee, correct?
Yes. So, and I think I might have been the one that made the motion to create the special committee, or at least I talked to Gino about it in conversation. I think the process, the way we set it up, is we would meet with CCP if they had something, then the committee would come back, gather the document, review it, and then prepare a recommendation to the board. The board could either adopt it or not adopt it. And I thought that's, when we had this meeting a month or so ago, I thought we were waiting for some documents to come back. We were going to get together, talk about it. Didn't happen. I guess my question is, there are a couple of these items which I think are not, they're less of a legal issue question in our mind, or are they all? Because you keep talking about 6, but there's 5.
There's 5.
Okay.
I lumped together. So
let's separate what we know today and what we don't know.
Yeah. So B, D, and 14 are time critical. Particularly B and 14, I think, would be the easier ones. I think D, as in dog, I think is the more difficult. Actually, probably one of the most difficult ones. And then the other items are also very legal in nature, but I don't think they're as time pressing.
Okay, because
I thought you said B, D, and 14.
Yeah, 14 is supposed to be E.
Yeah, it's supposed to be E. But
Okay.
Should have been E.
So it's 5, not 6.
So B and 14 or E are the two that you think are the ones that need to be acted on?
B,
Yes.
D,
B
and
is a
14.
boy.
B,
Yeah.
D, and 14, right?
No,
Yeah.
you said not D.
Bravo, Delta, and 14.
Yeah,
Well,
that's
thought
what
you
I
said
have.
Not D for
I said
today
B.
because it's complicated.
So B,
Well, that's what I'm
No,
asking.
well, so I said the ones that are time sensitive are
Uh-huh.
Bravo, Delta, and 14. The one that is, those are time sensitive. The one that's complicated is D, as in dog.
and I think, well, okay, of those 3.
Of those 3.
Okay,
Yeah, of those
so I agree with you that B is probably, and I'll defer to the general counsel, I think B is something where we're just agreeing to apply as a cluster. We don't know if we're going to get awarded.
They've already applied. They're in protest. This would be to accept it if we get it.
Correct. Okay.
Yeah.
So I don't think there's, unless
I don't know. I haven't reviewed it.
okay. I'm less concerned about B, of us having an adverse legal opinion on it, than some of the others. So I think B is something that I'm comfortable discussing, and maybe with the caveat that subject to final legal review. I think E, if I understand it right from that meeting, is not a controversial issue. There's nothing to, and I'll have you walk you through it.
Standalone, they shouldn't be controversial,
Right.
but I will point out, and you'll understand what I'm going through it. If you have a problem with D, then that means the other 2 agreements, we would be taking on the full risk, which would be a change in direction at the CCP level.
Correct.
I take that back. We didn't give any direction, so Memorial, our partner, made a direction to utilize a downstream partner. That would eliminate.
Right, and we haven't really fleshed out the downstream partner and what that would mean from a legal standpoint. And it was my first introduction to it at CCP a month or so ago.
Who
So
has seen these contracts?
what's that?
Who has seen these contracts?
So there are no contracts yet. So what we tried to do, because like I was saying, it's very, I understand, I empathize, it's difficult for Jackson as a downstream partner, and it could be any provider. Originally it was going to be Miami Children's, but that didn't work out. As a downstream provider, since we didn't get awarded the contract, they haven't started the negotiations of what the contract would even look like. So from a business perspective, I could tell you what the arrangement is being proposed. And what CCP tried to do is their best effort to put it in a form template so that legal and compliance could try to decipher the
Just doesn't say anything.
intricacies of it. So,
Yeah, it doesn't
and
say
it's, I think it's complicated.
And if we get awarded the cluster, and if we protest and we win, and we voted to go forward, and our legal counsel outside comes back with a different opinion than Memorial,
On the downstream provider, you mean?
well, on B, let's start with B, because B is going to dictate D eventually, right?
Yeah. So B.
What position does that put CCP in? If we vote, let's assume we take it up and we decide, okay,
You're only negotiating at that point. If we're awarded it, it then enters negotiations. So, and part of negotiations is signing a contract. So at that point in time, if legal or compliance or wherever the issue was in the contract that they would be offering us becomes an issue, then we don't put our vote forward.
so if we vote no, and Memorial votes yes,
Now
does it then go to a mediation?
My opinion on that is we lose it because by the time we get out of mediation, it's a null point.
No,
So,
but what
No.
what does the partnership agreement say?
It doesn't. You have to have two parties
Yeah,
agree.
it has to be unanimous vote for the
Right.
major decisions.
Unanimous vote.
Yes.
There's no deadlock. I mean,
Yeah, there's no deadlock clause in
There's
the
no
operating
deadlock clause in
agreement.
it. That's
Well,
right.
the deadlock clause is mediation.
It's mediation.
Yeah.
But this particular issue wouldn't be a deadlock because if we went to mediation, it'd be long past the time frame which we would have had to act on the
Right.
cluster.
Right.
So what is the time again? The time sensitivity? Because I couldn't find a date.
The time sensitivity.
No, I get for mediation, but today versus having a special meeting. Why today versus not the 26th?
For the CMS cluster?
Yeah.
Oh, so no. It's when I say time sensitive, I mean by the 26th.
By the 26th.
But when I said non-time sensitive, I mean if you don't get to it on the 26th, it's not a big deal.
So could you
not
have a
urgent.
special committee meeting before the 26th?
I thought there was something that was a big deal for the South by the 22nd.
It's a big. So what they want to know by the 27th.
By 27th.
Yeah.
So what do they want to know by then?
They want to know: are we on board with CMS? Are we on board with
Right.
Jackson as a downstream? And are we on board with Florida Healthy Kids?
Okay, would
Those
we?
three.
Do you think there's any chance we'd have a satisfactory legal opinion that we in time for the 26th on D?
On D, probably. Well, if we see a document, I mean, the documents are just a boilerplate, say nothing. So we need the details of what does it look like. And you know, when there was a letter of intent that came up previously, and there were terms, if Gina remembers, that were not acceptable to the Broward Health that Jackson wanted. And so it would really be.
That was the original.
That was the original.
I think what you're saying is I don't put words in my mouth.
Okay, so can you walk through E real quick? Just
Yes.
walk through the basics of E.
So E is the Florida Healthy Kids contract. So Healthy Kids Corporation, they ensure access to quality healthcare for Southeast Florida region. That's from Fort Pierce all the way down through Key West. They're essentially an insurance provider. They're acting as an insurance provider, and they put out to RFP, which we are protesting to get the business on a fully capitated level. So what that means is we would get approximately, because it's not definitive at this point, approximately $110 million a year to be fully responsible for the care of those 69,000 lives from Fort Pierce down through Key West. That's the extent of that contract.
But how could we provide the care north and south without
So
answer on D?
exactly. So if we didn't use Jackson, we would be fully responsible for it. So we would have to individually, and I think CCP is pretty well armed with, in terms of provider contracts, they have providers. The issue isn't so much that we want to be able to get the providers. The issue is that out of that 69,000 lives, about 29,000 of them are in Monroe and Miami-Dade counties. The issue is that we're not exactly 100% familiar with what the cost structure is going to look like there because we haven't operated there. So the plan to use them as a downstream provider was to take essentially half of the risk for us. So we would essentially, and I'm throwing numbers out there, but let's call it 10% would be the administrative fee we would charge. So we do get revenue from that. We would then do the back office work, and Jackson would take the capitated risk of that half. So we're very comfortable with everything north of Miami-Dade because we've been operating in that realm and we understand the cost structure, we understand the providers, we're comfortable with it. So this would really be a risk aversion tactic.
But virtually, the plan you had and the plan I heard mitigates our risk completely because it puts it on the Jackson. We still get some revenue because of the administrative fee of half of that with our partner. And then the risk is mitigated completely. You're going to take all that risk and pass it to them contractually.
For those lives.
For that portion of the lives.
Yeah.
I don't see, I understand risk. I understand penetration rates. I understand all of that. I understand Healthy Kids, and I'm actually going to abstain on that because I'm on the contracting committee for Healthy Kids. But it is what CCP is doing. This is not Broward Health doing this. This is CCP with the provider network, which contains other facilities. It's not us. It's not just us. So CCP, which we are a member of, is connecting those folks from Fort Pierce down, whether through Jackson or whether through our own network that they have. They're connecting those kids to those services. We're hoping to get some of those kids at Broward Health. It's a separate deal. The risk here is CCP's risk, and we will get some of those patients. I don't see the downside. I just don't see the downside. If in fact the 27th is the date, if I'm the one pushing this, and we have this process, then let's have the meeting before the 27th or the 26th, and let's put on the 26th the agenda to pass all the issues we need with CCP and get this done. But I would also ask that we come up with a more simple process where we can be a little bit more fleet of foot and get things done. In this case, you have 6 items that you'd like to get done. Let's have our meeting and get it done.
Is Jackson Health already locked into this?
They submitted a deposit, for lack of a better word, and they did, yes, they've committed to it.
So the chances of Jackson backing out is minimal. It's not going to happen.
It's possible, but I don't think they would.
They want it.
They want us. This is we're the only vehicle.
Yeah.
It's a good business to be. It's all of this is actually a good thing for us. That's why I don't want to see us blown. I think CCP is profitable. I think the number of patients that we get is good for us. It's better to be a member than not to be, and a controlling member to some degree is even better. So if we can have our meeting, does it matter if we could do that meeting via conference call, couldn't we?
Well, we have a board meeting September 26th.
I know. What I'm saying, we have to do it before 26. So on the 26th, we can do it, Ms. Barrett said, and come and present and get it done.
At least it would give those of us who are new to this some time to understand exactly what's being asked of us.
I think that's completely reasonable, but again, come the 26th, I don't think you're going to be able to make a vote on anything other than yes, proceed via operationally, with assuming you have compliance and legal input on the final product.
I mean, but protesting the cluster seemed pretty straightforward because we're just protesting it. We don't know if we're going to win the protest.
Well, that wasn't so the ask.
I don't even know what you're talking about.
So the ask on the. So let me tell you the other one. So I told you the Florida Healthy Kids. It's 69,000 lives worth 105 million. The CMS Special Needs Cluster, which is Cluster 3, that's only 21,600 members, so it's less members, but it's $490 million a year because they're special needs kids, so it's a lot more money. So same thing. What CCP is looking for direction on is if we get approval, if we win it, if we win the protest, do we give authority to enter the contract with CMS and negotiate? Same thing with CMS. We would be cutting about $252 million of that at risk out if we partnered with Jackson. So it's the same deal.
Let me hold on one second. I could be missing something here, but if management or operations comes back and says we are 100% behind this, we want this, we think this is right for our organization, and then legal and compliance says there's no issue to us proceeding, I know myself, I would be supportive of something like that. So I guess my point is I don't really know exactly what we're even voting on. I understand talking about it may not be a bad idea, but even if we were to vote and say we are supportive of what management's recommendation is, it still is going to require compliance and legal to say okay, there's no reason why we can't do this, right?
It's going to set in motion a series of events that may end up costing CCP
Well, I think
a problem that would cost.
Can I tell you what I think the problem is? So, the reason you don't see an issue with this is because we've already went down the path. See, the real problem was, and the reason I didn't give approval originally to apply is because, you know, I've been talking to Lynn pretty closely on this, and there were some concerns with past arrangements. So the issue was, if we were going to apply with Jackson as a partner, for me to feel comfortable, or Bev to feel comfortable, or the board to feel comfortable to make that, to apply, because you're applying to the state saying, yes, this is our intent, right? We would need to know, what does that look like, and is it legal? That's where it would have been difficult to get an answer then. Since that ship has already sailed, this particular one may be a little bit easier to address, but going forward, I think we're still going to have some complicated issues to work through.
Well, here's the thing. We're a 50% shareholder.
Yeah.
If CCP votes as an organization, CCP votes as an organization to move forward with something, that means we, as 50% shareholder, have agreed.
Yeah, but we didn't vote.
We haven't voted.
I'm not saying you have. When you vote at CCP to enter into a contract, if that vote passes, that means we, as 50% shareholder, have agreed.
Correct.
I'm going to operate under the assumption that we, as the 50% shareholder, wouldn't agree to it if that wasn't something that the management team was going to come to this board and say, we support. Correct?
Correct. We didn't vote.
We are supporters. We never would have brought this to
No, I agree with that. But what I'm getting at is the only thing that would cause any agita or headache would be a legal or compliance issue, which we can't assess right now.
Correct.
We probably can't assess on the 26th, right?
I would argue that they couldn't, right? No, what I'm saying is, I don't think we'll have an answer
documents
whether or
aren't
not
going to
it's legal
exist. Is
compliant
the
by
point?
26th,
Am I correct?
There were two
Okay.
legal and compliant issues, right?
Yeah.
The first one is the concept, and the second one is the documents.
Yes.
So what we're saying is the special committee meets, right? Because the duty of care of the fiduciary of the board member is to reasonably rely on management, knowing all the facts that you need to know to make a decision. And so if people are saying they don't know, and they're just gonna say, that is a question under the duty of care, which I think Commissioner Kline, talked about that before. So I think the first issue is the overall concept, followed by what are the documents.
Okay, but I don't disagree with any of that. The problem is on the 26th, we're not going to have the documents anyway.
But at least we will have the concept. I have no idea what these things are.
I totally
and
understand
I have 2
it.
weeks to learn, and Ms. Passett
I'm not
said
disputing
she
that.
will let me.
I'm fine with voting on the 26th. Don't misconstrue
I
me.
think maybe you're saying the same thing. So, are you suggesting that on the 26th, I'll brief the individual board members before then, right? Everyone will understand the concept. We'll be able to make a determination one way or the other conceptually, and then if it comes down to it and we win it, then obviously we'll have to see the documents before we officially execute it, right?
I think
that's
at a
reasonable.
minimum, as a partner in an organization, we have that at minimum responsibility to do. I mean,
I think we should attempt to get everybody briefed. I think we should try to gather as much information as we can related to, we may very well disagree with the South's legal interpretation of some of these businesses, right? So the only concern I have is that we vote to approve something today or the 26th, subject to us getting a legal opinion to support that we believe that we would be not in jeopardy, or that the arrangement of adding an HMO doesn't affect. There's a lot of issues there that we don't know. We might not have an answer. But what events has that put in place that CCP could be then in jeopardy if we ultimately come back a month later and say, you know what, our legal opinion is completely different and we can't do this?
Well, that was my point. Whatever it would put in jeopardy is already sailed. So if we say no now, That's already happened. We've already
No,
applied.
if we say yes, subject to a legal opinion.
Nothing, because our saying yes right now, the only thing that would do is let CCP know that we're on board with this, so that when we get it back, we can start entering negotiations.
Okay.
See,
If we would propose this.
right.
Oh,
See,
okay.
the proper way to do it would have been for us, the board, to give approval to apply. Since we already applied, the only thing, if you said yes right now, nothing would happen. If we won the cluster, they would have to produce documents, negotiate, send it back to us to review. So in the future process, you're 100% right. We'd be putting CCP essentially at risk if we gave them approval to do something and then changed our mind later. But right now, it's a sunk cost.
So do we have to the 26th or 27th
Mm-hmm.
to give you an answer,
Yes.
Mr. Ben? Is
to-
everybody
Fine with
comfortable that they will have enough time to get briefed? I know Nancy,
Yes.
Chairman?
Yep.
And you could try to gather as much information as you could.
But my understanding, Gino, is that the HMO is not part of the cluster.
No.
So that's different, and
No.
that's not a time-sensitive issue.
Yeah, those
So-
3 things, I don't think I can get 6 things done by the 26th.
So the
It's a lot.
3 things,
BD.
I'm sorry.
I'm
So
saying, are we missing
BD.
something?
Let's hear from John Benz, please.
BD&E.
Yeah, we are.
John Benz, President and CEO of Community Care Plan. I'm all on board with BD&E, okay? Getting it done by the 26th and 27th. And I would agree with your observations, okay? The fact that we know these contracts are with state government, okay, for all practical purposes. The CMS is Department of Health. The Medicaid contract is with ACA, and Florida Healthy Kids Corp is a quasi-governmental entity. So you're not really going to see a contract from the governmental entity to CCP that you're probably not going to live with. You might not like it, but it won't be a compliance issue. Okay, you know that. Now the contract, the question relates to, for me, I personally didn't want to take all the risk as it relates to Miami-Dade, Monroe County, and we have a ticket that Jackson does not have. Okay, so we offered the ticket out and said, we'll take a fee for administrating the program, and you take the medical risk. Okay, that's what the intent is, the letter of intent is, and there's a kind of a template provider downstream risk agreement that has to get approved by CCP, Broward Health, Memorial, and Jackson. Okay, but you got to win the bid in order to make it work. Okay. As it relates to the first item, which is the interlocal agreement and the operating agreement, I stood here 4 years ago in February of 2014 and got that passed. That is the documents that control CCP. Inside there are some limitations that were put in and conservatively by both the North and South Broward Hospital District that do not give CCP or the manager the flexibility to go forth. We can address those subsequent to September 26th, okay? I have no problem because they're not inhibiting today what we need to do as a business to go forward at CCP, okay? So as it relates to where we are, I will make myself available with Gino, with anybody, to talk about anything. We're heavily into the Medicaid contract. In fact, the first part was not even here. The one you've been living on for 5 years. We won the second 5 years. Tomorrow they're coming for what they call the readiness review. It goes live on December 1st. We have 5 other contracts that we bid on that are under protest. Okay, and we are working hard to either win or solve, okay, that solution. Okay, but those are really the essential elements of taking care of kids for the most part, because most of our business in this case is 90% kids, okay, in favor of the SAWA and the Joe DiMaggio Children's Hospital, and these impoverished kids, I'll call them, okay. So we CCP are just an extension of the North and South District doing our job to improve the health of the community, kind of focused on kids. So if you don't do this, what will happen? What's the alternative? Okay, the alternative is the private for-profit managed care companies will come in here and you will become, instead of at the top of the food chain, you'll be at the bottom of the food chain. Okay? And it will just affect your revenues, and you won't be able to do the right thing for the kids. My love is poor and children. Okay? I will fight for this. You know, Gina knows how hard I fought to get here 4 years ago, 5 years ago. So, and I'm willing to, you know, I don't have a problem when I see a kid in front of me and it's the right thing to do. I'll take on the largest corporation in this country because I think that you are doing it for the right reason, and CCP represents you and the South District extremely well, and is a growing brand, okay, and growing flexibility to be your engine for population health in Broward County, including those kids. So I stand here as a passionate person asking for consideration. I understand compliance. I understand the legal side. I've got 5 years without violating it, okay? And I don't plan on putting stripes on me, okay? Because I'm getting too old to do that, okay? So I appreciate your time. I'll answer any questions. I'll work with any one of you, anytime, any place, on behalf of the kids that are under this contract.
So I think we should try to get as much of a briefing as you do by the 27th particularly on the 3 items that are time sensitive. And
table the other 3. And it is 3. The reason I'm saying 3 is because on the agenda, the interlocal agreement and the operating agreement are 2, but it's on one.
Right. And that's something we could actually see the document on, right?
Yeah, correct. 100%.
And you should get us a copy of that.
Absolutely.
Understanding that the 3 issues, the time sensitive ones, let's see what we can get by the how comfortable we can get by the 27th, and hopefully be able to get an answer one way or the other. 26th. The 26th, I'm sorry, 26th. And, you know, it gives us 14 days or whatever it is. Yeah, for B, D, and E. Because I think you're saying that those are the ones that are restricting your decision making going forward. And
I'm fine.
Fine, okay.
All right,
Done.
I think we got our marching orders between
John,
now and the 26th.
I have a question for you though. When you talk about the coverage south of us, you've got Jackson, you know, covering Miami-Dade, and I presume Monroe as well?
Yeah, it's Miami-Dade and Monroe.
And then how do we get coverage north of us?
How this works from a practical point of view, you have your network in Broward, which is your physicians and Memorial's physicians and the hospitals, and we CCP contract directly for that entire network. We have the same CMS network. Remember, this is not new business. It's an at-risk business because we've been administrating the CMS kids since 2006.
Right.
We have a network all the way up to Fort Pierce, to Sarasota, to Key West today. So what we would be doing is lighting up that network. Now, the way the risk would be set, Commissioner Klein, would be anybody who lives in a zip code that's in Miami-Dade or Monroe County, that risk for that person would fall to Jackson. And any of the risk from any member from here north to Fort Pierce, which is the northern end of this thing, would fall on community care plan, which is you in turn, okay? But we have hospitals north, we have hospitals south, we have providers, PT, OT, all those as a typical provider operation side of a health plan. And we've done that this started under Jeb Bush in 2000.
So are you suggesting that we're taking all the risk north to
Yes.
Fort Pierce?
Yes, sir.
But we're
taking all the risks that Jackson doesn't take.
right, but we could theoretically take all the risk to Jackson, the south.
You would
if
have
we
that
wanted
right,
to.
yes.
But why would you take the risk north and not south? Maybe that would be helpful for everybody to understand.
In the bigger picture, the referral patterns come from the north down to Broward, and those who are referred in Miami-Dade stay in Jackson, okay, and Miami Children's, okay. So you really don't get any referrals back to Memorial or Broward Health.
So we would take in the risk, but we would get no downstream business from it or referral business back up here because they're not coming north.
Correct.
But for the north, they do come south.
Yes.
So John, what I think you're trying to say is that you can provide better quality of care to the patients from the north than you do from the south.
I can. I mean, and Jackson's the natural partner for you here.
We're not going to vote on anything. Can we just move this? We should all just get our individual briefing. I appreciate it, John. I do want to speak with you and Gina, but I think we just got to keep this thing moving along. And since we're not going to take any action today, but we're all committed to getting briefed and take action on the 26th.
I appreciate your time. Thank
Can
you.
I just add one thing? I think at some point we will need to look at the documents. I think when we built this together, we built it with a complete lack of trust, and that's why there's control mechanisms in here by both sides that are probably burdensome, if you ask me, that we need to look at some point soon. I think we put ourselves at more risk by staying as actively involved in a third party in another company than if we didn't. We're overactive, in my opinion, on a project that's. I know you have reinsurance. I know you're mitigating the risk every way you can, but I'd rather have less involvement than more involvement than the involvement we have today. But that'll be for another day.
Yeah, item A here is in black and white and it's visible, so, but we'll take it off the table for now, okay? It's just really modifications to the operating and interlocal agreement, which is, there's 4 or 5 items in there. You can see it in the black and white. That's the only thing you can see in black and white today is that, okay? So thank you for your time.
Thank you. Thank you very much, John. All right, with that, I think the course has been laid out. I think we can move on to the next item. Item 15, board operations.
So there are 3 things on this. 2 of them we don't have, but I wanted to go over B. So where can you find B? The agenda policy. Is that in here? So in working with Patty over the last month or 2 and watching how our board meetings get structured and changed, I've got information in different ways of how our meetings are set up. And as you guys see from this meeting and the structure of it, it's not the most efficient process, how we set our meetings. There's also, when I would ask the question about, how and who's allowed to do what, I'd say, show me the policy, and I didn't see policies. I heard that's our practice. Well, practice doesn't mean really anything. You need policies that are solid. So what I'm proposing here is that we enter into a series of 3 just for the board. The agendas, which I think you were all forwarded a copy of what I had proposed. There's going to be a minutes policy shortly thereafter that Patty's already working on. She's also working on an orientation manual for board members and liaison. I'm probably the last one to go through an orientation. I think there's some things in there that we can do a little differently and possibly better. There will be 2 new board members. I don't know if you noticed, but the governor's on a tear today, so he's appointing people left and right to all the boards that you could possibly see. So I'm guessing there will probably be an appointment or 2 to us tomorrow or another day, because he generally does this in batches. So I'm thinking there's going to be another appointment, and it'd be nice to have a new board member being oriented appropriately. So we're trying to rush through that. Let's talk about the agenda for a second, if you don't mind. I know this is A, B, and C, but the agenda is the only one that I really have done, and it's a draft. It's a suggestion as to how we operate. Do you have those, Patty? No, the one that I did. So if you could hand those out, I'd like to talk about those.
Could I just interject
Yes.
on the minutes policy? So the minutes policy, I think Commissioner Yuri was definitely here, was a policy was created, approved by the board, and is in policy stat, that repository for all the policies. So the board decided to make the board minutes more consistent with both Robert's rules and the Sunshine Law. Brief summaries, action items. Is that that is?
Yes, it's for the minutes.
So if you want changes to that policy actually already exists.
It exists, but I invite all of you to sit with Patty over the next month and watch her document these minutes. It's a cluster. It's everybody wants input. Everybody kind of wants to have their say in it. People are looking to pull different things up. Minutes should be 30,000 foot. Brief. Here's what happened. 100%. They don't need to regurgitate everything we say in these marathon meetings. So I will look at this myself if the board sees fit, and see if there's changes that need to be made here, or maybe it's just that we need to reinforce everybody that this is how the minutes get done.
I think it's the latter.
That's what I'm assuming
we
too.
took a great deal of time in coming up with this, and I'm not going to go back and relitigate the horror show that we had here, okay? But there is also risk to an organization that ends up verbatim, I mean, it's just
Quasi-verbatim.
even quasi-verbatim. I'm personally very satisfied that the policy is robust, but also minimal. And it just needs to be followed. That would be my. Well, like a lot of other things that we've been working on, this is another improvement, right? So, even in the past year being on the board, we had a lot of discussion about forms of minutes. There was narrative versions of minutes, and then there was former Chairman Rodriguez spent a long time talking about the form of the minutes that he did not like and did like. So it's something we need to get ironed out. It should not be that difficult, right? That we've all been on boards, we've all served before, we know what minutes should look like. Let's just
it's
look at the current policy and
follow.
see what it needs. We circulate draft, right? If there's objection to it, it gets modified and then adopted. So I think just something that needs some attention. I'm glad you brought it up. Yeah, but I think to the point, and I apologize, Commissioner Barry, I haven't had a chance to read what you had put together, and that's my fault. I've just been a little busy. But when it comes to the agenda, I think one of the issues that we end up dealing with here is kind of it's the only opportunity for us to meet and talk, right? But the reality is we're here to meet and act. For sure. Okay, and talking and talking and talking and not acting is what, at least my perception is the reason why we have marathon meetings. Okay, and as much as I love hearing everybody talk, I know I'm not that important to just talk. So I'm going to shut up right now. But that's what I think is the major problem: is we need to be focused on action. And talk about reaching that action as opposed to just talking.
Yes, and that's why in this. So I asked a few questions. I was told that the chair can pick and choose what other board members put on the agenda. That has not been anything I've ever seen in the past. The chair can organize the agenda, and most of the boards that I'm on can organize it and do the order of things. And I think Ms. Barrett and I went back and forth on that a little bit, but through Robert's rules, I think the clarification is that the chair cannot take an agenda item off that another board member wants to discuss.
Right.
But up until that clarification, the pressure was on Commissioner Klein to respond and tell Patty, yes, that can go on. That I don't think you've ever done it. I don't think you've ever removed anything off. But I think clarifying the rule is critical. Practice at Broward Health means one thing. Policy is another. We don't have a policy for the board agenda. We were setting this agenda last week on Thursday. Friday, we're putting things in. This needs to be sent out to the public. They know what we're going to talk about. There could be somebody in the community who wants to show up for one item, but not another. If it's not on the agenda, they're not going to waste their time and come to a meeting like this. We need to be clear with our communication to the community. So what I have here is that, and I think you guys have all seen this, that the administrative preparation of the board agenda and notice, by charter and bylaws, they're delegated to the board designee, the CEO. They have to be done. Right now, the board designee seems to have changed to Patty, but under a normal circumstance, it'd be to the CEO of an organization. There'd be a uniform administrative agenda process, and if you guys remember, I don't know why we don't have them. That says that no less than 5 days. Now, I highlighted for you the 5 days, and the reason I did that is that's not enough time. We have to get it to the press 7 days.
In order to get it in the paper, my understanding for the Sun Sentinel, it's a 2-day.
So that's 7 on top of the 5.
Right. So when Commissioner Klein, we met for quite a long time to go through this, and it was decided it would be 10 days. So so that you would have sort of a grace day, and then you would have at least 7 days published.
Perfect. So that I was the reason I highlighted is for the board to say, you could change all of it. Obviously, this is our document, but I highlighted the things that I thought you might want to change or turn. That's one of them. I believe the 10 days is fair, but I also said that if I'm going to send you an agenda item and say I want to talk about CCP, then it's my job and my responsibility to work with Patty to get you the backup for that. Not for Patty to go on a treasure hunt or one of you to do it, but that if I put it on the agenda, then it becomes my responsibility to get that information over at the same time. We don't normally do that. We throw out lists of, here are the 5 things we want to talk about. And then it's a treasure hunt to go find the backup, talk to whomever. The secretary treasurer, there are a couple things, and as soon as Patty comes, you'll be able to see the same thing. The chair, number 4 was the chair shall designate the order and organization of the agenda, but shall not limit the items properly submitted. That's reiterating what I believe and what I believe Robert's rules says.
Right, and so technically, since I've been here, I've done the Robert's Rule way is to actually adopt the agenda at the beginning of each board meeting. We've never done that since I've been here before, but that would be another addition if this is going to be a policy and you do want to follow it. And then at that time, anything that hasn't gotten on the agenda, you wouldn't have to do walk-ons, but you would adopt the agenda formally.
I'm really not a fan of walk-ons, even though I've probably walked on more things in the last 2 meetings than anybody else. I'm not a fan of it because I think it doesn't give the community or the other commissioners an opportunity to review, respond, and be educated coming into a meeting. So I think whatever precautions we can do against that, walk-on should be extremely limited. And I don't even know, you're going to have to tell us, Ms. Barrett, if there's even a provision in law that allows that.
You are allowed a walk-on under the Sunshine Law with the understanding that the Attorney General and the opinions have said that an agenda, which is not required, is guidance, and it should never prevent the board from doing the business of the board. So if something comes up, the board should never be prevented from taking an action item or discussing something because it's not on an agenda.
So does anybody have an issue with that item? The practice has been, even though I don't think it's ever actually happened, that the chair can remove items, right?
Robert's Rule says they cannot, but the practice has not always been that way.
So this is setting a policy that says,
my challenge on that is I don't know that that's happened or not happened. My experience has been that if I've asked to have something on the agenda, it's been on the agenda.
Always.
But if that has transpired, I'm just not aware of it, and I'd be not happy about that.
Yeah, that happened to me tonight. I don't know how it happened, but I had specifically asked that Nigel Crooks.
Okay, so this is a perfect example because we could have possibly.
But I don't know whether it was
we could have possibly. No, and I'm not suggesting this. We could have possibly avoided a situation where I wasn't supportive of something and potentially Mr. Crooks misconstruing my reticence here.
And that's the strength of an agenda item.
And I think that's especially because we're on the agenda should be actions, okay? Not we just want to discuss something.
Well, let me just explain. One of the first thing I did is when I was elected chairman back at the end of April is I called a meeting with the executive team and council. And said we need to get some organization to our meetings. We would sit down at meetings and be handed piles of materials, being asked to review them and vote on them. The public had almost no notification of what was coming before the board, and I felt that was not satisfactory. So the first thing we did is to say we're going to have a schedule. So we want an agenda drafted and circulated 10 days before our meeting so that everyone knows what's on it. If there's going to be a late addition, it's an exception, not the rule. There's always going to be some emergent item or potential walk-on, but it shouldn't be half the items on the agenda. The other big change is that items need to be circulated with support 7 days prior to the meeting to the commissioners so that we have the opportunity to review them prior to sitting down at the meeting, and we can ask for briefings and we can have follow-up if we need them. Unfortunately, this meeting we've had a lot of things added. Last week was difficult. We had a holiday. Several of us were out Monday and Tuesday, and we've got a very large agenda with a lot of things on here without backup and without supporting materials. So this is not the ideal way to run our board meetings, and I think we need to all recognize that. All that being said, I think it's a good idea to evaluate these procedures, but we need to consider what the law requires of us in terms of our charter and our existing bylaws and what that says in terms of how this needs to be approached and whether we need to actually amend our bylaws and if we're allowed to do that under our charter, because obviously that's not something we're able to amend ourselves. So we need to make sure we're acting consistent with applicable law. And I think with all that background, what I'd like to suggest is we take these materials, we consider this at a further meeting. I mean, it's 6:38 now. We still have a few things to get to. I think we've introduced the topic, but I'm not sure we're going to make a lot of headway. As Vice Chairman Yuri said, if we're not going to vote on it, let's move on and get to some other action items for right now.
This is the type of stuff that Commissioner Yuri also talked about. I don't. How many things did we vote on tonight? We pushed most things back. I assume we need obviously time to look at this, but I did do, and I had help. I did give you reference in where the law is, the bylaws, so go ahead and verify it. But we do need to have a uniform approach to setting agendas. It is a nightmare getting this done. Patty, I think you could and would agree that setting the agenda has become problematic, and how the process isn't really detailed. It seems to change meeting to meeting. I would ask that everybody look at this in all seriousness. I've looked at some minutes from previous meetings. There's a lot of things other boards that have suggested, or not suggested, voted on, that you can look and say, well, really, that became part of the process. Maybe it did, maybe it didn't. It's not really clear. Item 10 for me takes care of a lot of that. I want to be able to say, this is it going forward. There's no, forget about anything else. It's like one of those contracts, right? All other conversations and all other motions are hereby nullified. I would have to read every minute of every board meeting for the last 20 years to figure out what was passed. Nothing's memorialized in this. I'm sure other boards have dealt with this. I'm sure other appointees to this board have tried to deal with this. If you look at one that I think is important that everybody really pay attention to, besides that one, is who can put items on the board agenda. Every board member should be able to. The direct reports should be able to. Should the medical staff be able to? They're on our agenda. Should we know what they're talking about before they come in? We always say, Broward North is going to have, somebody's going to speak. We have no clue what they're coming at us with. We have no idea. We could have avoided that one relatively uncomfortable, almost HIPAA violation person that we had come in who made a mistake. Probably should have never got to us. We could have avoided that by them telling us what they want to talk about in the board meeting. So who are the people? And I think everybody needs to think through who are the people that get to do it. Because if you accept the fact that the chair can't remove anything off of the agenda, you need to know who you have putting things on the agenda, and that they're going to do things in the right way. But I agree with you. I know it's not going to get passed tonight, but I do think it's important that everybody take a look at this and mark it up. And I think go back to Patty and say, here are suggestions. If you mark it up, please do attract changes so we know exactly what you have an issue with. And let's bring it up at the next board meeting, but be prepared to have serious discussion about it, get something filed and done. We need to have agendas memorialized.
All right, any further discussion on this item? I think that's very helpful. We need to make some headway here. Moving on to item 16, supervision, direction, and evaluation of board reports. Is that, I don't know who put this item on there.
It was probably me as well. And we talked about that earlier today. When Mr. Crooks asks for time off, who does he ask? When when Nick does, or when Linda, who do they ask for time off? Right now, I think you and Barrett probably have the best relationship when it comes to that. I'm not sure, has Nigel ever asked you for a day off? Should he? He's a direct report. He shouldn't ask all 5 or 7 of us, because 3 of us could say yes and no. At the same time, when they ask those questions, even though Ms. Capazza is not in that line technically, we have to do some type of coordinating with her to make sure there's not something we don't know about, or that she doesn't know about. She may need general counsel for something 2 days from now, and then the general counsel comes and goes to Commissioner Gregoire and says, I want time off, and it's not considered that that Bev potentially needed her. Same thing with Patty. If Patty asks for time off and I'm her direct, I'm going to say, did you check it with Ms. Capazza to make sure that that was done. I do think all of the direct reports need to have the same thing we're talking about for the CEO. We should have for all of them what the KSAs are, what the expectations are, time off, all those things that are in supervisory relationships need to be formalized somehow, and I think I wanted this to go to the HR committee, so I'm a little surprised here, because I do think HR should do this and say, the committee chair of that particular area is that. So we don't want to say Commissioner Uri is, right? We want to say the committee chair for audit is that person. So when that changes, the kind of transitions, and there's an annual review process. When's the last time, Ms. Barrett, you've had an annual review? It's a couple years old. You know, it isn't fair to the employees to not have a review and to know where they're going and what they're doing. And you know, I would, if I were Ms. Barrett's supervisor, I'd ask for the other board members' input somehow either through the open meeting the way we're supposed to, and then sit down with her and go over that. I think it's just fair. We only have 4 reports. We should be able to do that pretty easy, or 5 now. We should be able to
the
do that pretty
review, there is a form, there's a process. You should schedule a time to sit down or at least over the phone, and then.
But we don't do it. I mean, right? Nigel hasn't been reviewed. Nick hasn't been reviewed.
Yeah,
we're still trying to figure out.
Let me just add some context to this and why it's here and why I didn't bring it to HR today. I think it's important. I wanted the whole board to have a discussion. Sometimes not everybody's at HR. My position on it is it was going to be on the October meeting because I think there's a couple of issues that we needed to deal with. One was the PLF policy. The other was who the board reports. I feel strongly that as we schedule the reviews, and I agree, we need to do them. There's 4 of them. There's one person who definitely has a specific time frame. I've never seen Ms. Barrett's contracts, I don't know, but Nick and Nigel are due for a review. They're relatively new in the role. I believe, and I looked, and I don't know what the policy really is, but I believe that if we're doing a review of Nigel as the internal auditor, that review process should be probably the chair of the HR. But I believe that the chair of the audit committee should be involved in that review because I think the chair of the audit committee would have the best knowledge of Nigel's role and what he's had done. If we're doing a review of Ms. Barrett, I think Ms. Gregoire, as the chair of the legal committee, should be intricately involved in that review process because I think Ms. Barrett and Commissioner Gregoire probably work closest together. When it comes to compliance, and we're doing a review of Nick, I believe the chair of the compliance department should be involved in the review because that's the close relationship.
Sure, every single board member would review.
I understand, but I'm saying is involved in setting up what are the things that we review, and I think there's got to be, and I don't know, I haven't seen a formal review form for board reports. I've been here 1.5 years, I haven't seen one yet. There was a booklet given to us, and so this is one of the items I wanted to bring up in October, is to really set this up, set a calendar for the reviews for the 4 board reports. Clearly the CEO reports and works most closely with all of the board members, of course, and so that review process, because the contract is going to be maybe slightly different than we do for everybody else. But I think we should gather whatever review information we have that's been done in the past, look at that in October, come to an agreement on a process, and set the calendar for the 3 board reports that don't have a scheduled review date. And we have 3 months to get it done between now and the end of the year. I think we should do it before the end of the year. Okay? And that process should be the same every year, and so that the board reports know when their review will occur.
Yeah, normally it would, but at least what has been done in the past, whether it's policy or not, I can't speak to. But the HR committee is the one that would schedule, if you will, hey, the review's coming up, this is the deadline, here's the form, so on and so forth. For every board report, it's incumbent on every board member to actually conduct that review and score it and so on, and then it would come back, they're all submitted, and it's tallied usually by one of the staff to put it into a spreadsheet or something, and then...
You might want to also consider a 360 review, and then
if you're familiar with the
I'm a big proponent of
I
360.
and I'm open to getting this going, but I haven't gotten the document as to what we've done in the past, and we got a booklet. We haven't had a chance to deal with it because I would have dealt with it this month had we had the meeting last month, and we could have dealt with a lot of the issues we had to deal with earlier. So I think we need to get on the schedule, get this calendared, and go with it. And I agree, and that's why I wanted to have it here at board just so that we're all on board and know where we're going with this. And everybody, I think, is committed to being at the next HR committee. So I think we should have that form review process. I don't have a copy of it.
What is this booklet? You said there is a booklet that exists?
Real quick, there was a booklet we gave about the reviews. The one thing that I would say is a review is okay and say you did a good job, you come to work, you dress appropriately. But if you guys as a board don't set expectation for your board reports, and the review is really just
that's all part of that.
You need to set goals for the next
opportunities
year.
for improvement. It's everything. It's all in
I
it.
think that's an important part of the review process.
So we, at the end of the meeting back in, and I think it was during the CEO workshop, at the end of that meeting, we were handled this as we were towards the end of it. We didn't have it beforehand. There was a booklet that had a whole bunch of stuff having to deal with job description of what they were and some information, but I don't think we've got a chance to really look at this.
So it sounds like what should happen is that material was distributed but not really reviewed and evaluated.
What's that?
I think that material should go on the agenda for the next HR committee.
This is the review form.
For discussion, refinement, and then adoption by the full board from there, so that we have some current documents.
But again, this is something that's been done in the past. Is this what we want to use?
That's what I'm
saying. Is this what we want to use? And that was my point. So I want to make sure everybody's got a copy of this, and let's have this set so that is this what the form we want to do? We want to modify the process? Do we want to add or take anything away from this process? And that's important.
Can I ask if that be recirculated electronically? Because
this booklet was asked of senior management to circulate it together and provide.
You remember what it is, right?
At one of our meetings,
I don't know how we got it, but somebody gave it to us at the end of the meeting.
Well, no, but the board asked for that to be provided.
Right.
And so in there, that's why when you said you hadn't seen the review form, I was a little confused. But that is the review form right there that we have traditionally used. If we want to change it, improve it, that's
and I think we should all look at this over the next couple of weeks and be prepared. If you have some things you want to add or take away, is this a process we want to use? Is this the review form we want to use or not going forward?
Okay. All right. So at least now we know we have something that's been used in the past. Let's evaluate it and see if we want to use it going forward, start from zero, or just modify it.
But I would recommend that we review the 3 board reports by the end of the year. Ms. Capassos, by contract, has a specified time frame. I think it's within 60 days at the end of I think it's in January. So hers has a date in the contract when we have to do a review of the other 3.
We have to do all of them.
Right.
But before the end of the year.
No, I think one is actually in January or February. The other 3 are by the end of the year. I think Ms. Capassos' contract has it says in there. It says in there within 60 days at the anniversary date of her. It specifies the time frame of when her review has to occur.
If it does do it in 60 days, she's marked as stellar.
Right.
Yes.
It does say something like that.
Yes.
I should mark that way anyway, but that's just my opinion. But item 17, follow up on the IOR report. We had a lot of discussion on that earlier. Commissioner Berry, was this your item?
We already talked about this, but I do think it's important. I'm a little disheartened that the response from half the executive team went already and is already in the hands of the monitor, because I think we need to have a coherent response to the monitor whenever we do anything. I don't think we should have different things flying over there without it going through legal and through Commissioner Gregoire's hands. I think our response to this IRO should be a single document or one document with the attachments, one group and another group, because I think the firm that's actually doing the second part of that review for us, we're not going to be able to manipulate or change that, but we can put them together and say, here are the actions as a board we took. we should be, when we talked about the monitor being frustrated, I don't believe it's frustrated just because of that one report. I think the monitor's frustrated because they're getting piecemeal items and they're not getting anything else. And it seems, I have to tell you, I was surprised that you had communication with her. I'd like to meet her at some point, but I'm going to wait until she asks for that. I think it's good that we're getting that she's meeting some of the folks and seeing that we care and we're actually trying to do something. I think it's really important that our message is in a unified voice. She is too important to us to potentially not get the right message and have that misinterpreted as chaotic versus we are heading in the right direction and doing the right thing.
My understanding is in the past, it's always been the chair of compliance has had the contact with the
It's what it's about. It's about compliance. And everything should flow through you to that response. You should at least review before it goes. And she unfortunately got that piece, which is only a partial piece. And it's really it's an attack on the IRO, whether you think it was or wasn't. It's an attack on the IRO, and they're sort of on the same team. So, at least my perspective is. No.
But going forward, we now know.
Yes,
we'll correct our mistakes.
But the monitor has it.
I don't know how she got it. Someone sent it to her.
Well, through a public records request.
No, it went from Lucia as part of her due diligence and pulling together all the additional information per I think the IRO requested additional information. So the IRO said, hey, you guys said you didn't give us everything. You have this time frame to get us everything. And it said till present.
Yeah. So.
But at the end of the day, the monitor wasn't terribly concerned about this back and forth. The monitor, just like a judge, doesn't want to hear the bickering of counsel. They want to know what the resolution is. They want to see what the story is at the end of the day. She said send it as an attachment to your annual report. When you guys do your annual filing, send it in as an appendix. That's fine. But it's not something that she was focused on. What the monitor wants to see is cooperation and communication. And when I reached out and said, hey, I'm going to be in DC for the folks who weren't here earlier, she said, yeah, come in and let's meet. We met for a fair amount of time. We had a very good discussion. And not only just about the fact that I wanted to convey that we as a board are serious about compliance and that we're a new team here and whatever happened in the past may have happened in the past, but we're cleaning it up going forward. But we talked a lot about how to go forward and what's important to her and what's important, as we attain compliance. And one of the fundamental points she made was the need to have cohesion and cooperation between legal operations and the board and our compliance officer. They want to see us working together, not fighting with one another. And I'll repeat what I said earlier. If we're not operating as a team, that's going to hurt the system and it's going to hurt all the people we serve and all of our employees. So if there's infighting, that's got to stop because we're all on the same team. And we've got to work together. So if information's being sent, to the IRO and not being given to the board, that's got to stop. I mean, we need to know what's going on in our system, and we should be the ones receiving that information. Through the compliance committee and to the board directly where necessary. We need to be hearing that information so that we can take action and we can set the policies that need to be set. So at the end of the day, we've got to get on the same team and start rowing together. So I don't know if there's anything else that we need to address on that. I think that encompasses item 18, which was the monitor correspondence. There's another organization email policy, item 19. Is there anything?
Yes. Yes. And again, I'm the difficult one. I apologize. I know everybody wants to go home. Our policy, I believe, is that the compliance officer and the general counsel can pull emails of any employee that's in an investigatory manner, if there's an investigation. Is that right?
Correct. Or, so the policy is pre-pulling grant was that the general counsel and chief compliance officer can pull emails. There's now a standard that I have to get permission to pull emails of a miscapacity. So I don't think that's appropriate. And so if it's an investigation, a subpoena, part of 119, of one records request. and it's never been before.
So every company has a policy, including mine. I am the only one that's allowed to allow anybody to look at emails in my company because it's a sensitive issue. It seems here we don't have a tight process. The permission, if Ms. Capasso could give the permission to you, then can you give it to other people as well to pull emails? Well, what's the policy? I mean,
There's no policy.
I think what
There is no
was that Janet, her secretary,
Put your
asked.
microphone. There you go.
Janet's, Lynn's secretary, Barrett's secretary asked Lynn for permission to look at some emails, and then they sent it to me to okay it, and I said to her, what's this for? And she told me, and I said, okay.
Okay, so great, so I don't need permission. That's excellent.
No, that's,
Hold on
I
a
didn't
second.
say that.
So Janet asked you for permission.
No, Janet asked Lynn for permission, and then when she went to IT,
then went to, so
so-
all the
so maybe what
investigation
we-
I
emails.
think what happened was is we have a new IT
No, this was
director.
not through IT. This was not the new IT person.
No, this is the
This is long
Hey,
standing.
forget the issue.
No, but the situation you're talking about.
Why don't we high level it? I mean, let's talk about policy. I mean, what
Policies.
what
So-
policy
so should we have the new
do we want to have in
CIO?
place?
the new
Let the CIO
CIO,
come back to us.
that'll come back, yes.
Let the CIO, there's a new CIO.
In the meantime, I'd like to not have to get permission. I don't think it's appropriate for a general counsel who's doing an investigation to have to get permission.
I got a policy in my hand here. GA 004233 Disclosure Program, which spells out who in this organization has the authority, the investigative authority, and who has the authority to gather information and conduct investigations. It's pretty clear that it's the chief compliance officer or the chief or the general counsel or the general counsel staff. There's a series of things in here. Nowhere in this policy does it say the CEO or any other person in this organization has the authority to conduct an investigation. So how is it that the general counsel has to go to the CEO to ask for authority?
So it happened once, excuse me, Commissioner Wellens, one time 2 weeks ago. So again, we have a new CIO. We'll have her review that.
Well,
If that's the policy.
I'd like a motion, though, that I don't have to get permission. Because this is going to delay now for
But it
weeks.
appears that it's already part of an existing policy that the permission, there's
It's
no.
an investigation.
It's an
Direction
investigation.
to the IT department, or to me, because you can't direct them, that I can do email reviews and document reviews without permission, because I report to the board and it's an investigatory subpoena or 119.
So you can pull board emails?
Oh, sure.
So I know
But that's
that
if there's a litigation.
No, it's an investigation. That policy, if it's the one I'm thinking of, is who and how investigations are conducted.
Well, I've never seen this policy,
and who has
so
authority?
It's part of
if
the
this was
policy
put on the
provided.
agenda, it needs to be presented in a way that makes sense.
Well,
None
I
of
can
us
tell
sit
you
here
who signed the
and discuss-
policy, the last
listen,
review
hold
and the
on.
signature.
What is wrong with
No, because
you start screaming.
I'm just saying there's a policy that we don't follow. And I think it's an invasion.
I don't know that we don't follow it, and I
We
haven't
didn't
even seen the
follow
policy. And what I find peculiar, I'm sorry, is that you show up with a stack of policies that just so happen. I don't even know. How in the world would you get something like that and then
Because I
not be
asked
sent
for
to
it.
the whole board?
So can we just take a little time out on this one? I believe with the new, first of all, I don't care about this petty issue we're talking about. There are 8,000 employees in this company that don't have a right to privacy in their emails. I hope they know that. I'm not sure how we publish it. Nobody has the right to privacy in their company, in particular in a taxing district actually, we're not a taxing district, I guess. In particular, in our situation, we're a public entity. However, there should be a set of rules for everybody, all the way down the line. So can Ms. Capasso look at the emails for a physician that's doing something inappropriate? I would think that there should be a mechanism to allow her to do that. I think there should be a mechanism for the general counsel to do what she needs to do. It sounds like we have a partial policy that talks about specifically investigations. That's great. I think you need that kind of freedom to do what you need to do. I'm talking about the greater, the bigger one. What? You have I have 100 employees, and I have a policy where I go, and I've had to use it and go in and look. You have 8,000. If you're not going in and looking, you're not doing something. but there should be some controls to that. It shouldn't just be on fishing expeditions. It shouldn't just be for the heck of it or to see what somebody's doing. There should be a reason for it. It sounds like that policy talks about the investigatory process, but I'm not sure that it goes all the way. I haven't seen it, so I don't know. I'm glad that there's one penned. I think we should give it to the new chief information officer and say, is this normal? Are we missing something? What don't we have? Organizationally, not just about how admin may not be getting along or feeling that they're getting their items looked at. We do need to deal with that, but there's a bigger policy issue here. Organizationally, how do we make sure? And the employees should know do not expect privacy with your emails.
I don't think the question I have is with privacy. I think we have a privacy policy. We have a disclosure policy. We have an investigation policy. I have a problem with anybody accessing the chief compliance officer's email who doesn't have the authority, because the whole point of the chief compliance officer's email is because the chief compliance officer is the primary person who would be receiving complaints, information, requests that could go through the hotline, but maybe they get emailed. Maybe there's documents in there that are under investigation. And the only person that should access the chief compliance officer is the person that has the authority, would be the general counsel, for if there was an investigation reason.
And here's the problem with either the chief compliance officer or the general counsel having to request permission from anyone. We're now in the process of having to follow up on the IRO report. There are investigations that have to be done, and they can't have their hands tied by asking for permission to do what their job is, which is to do these investigative.
Guys, we have to, let me just take a time out here. I have never requested anyone's email. I care less about the emails. The only email that we've ever requested to the chief compliance officer, and if you want to talk to the log, and I'll go on record, is the one time when we thought that the OIG's emails were being bounced back, and we asked to go and check to make sure that all emails from the OIG to this organization were not being bounced back, and that would have been the chief compliance officer. Either that, I don't care. And if I want to check someone's email, by the way, I don't need to do an investigation. I'll just call them up and ask them and ask for their emails. I don't know why we have to
But
be
are
so
you
secretive.
confirming that neither Nick nor Lynn have to seek permission to do an investigation, including
I just got this
email?
It says I'm the sponsor of it. This was approved by somebody that reported to me that they're no longer here, that I never approved. I've never seen this policy in my life.
Well, just all we need to know is that there will be no permission necessary for them to do their job.
I don't know that we can decide that today. I mean, we don't know what this policy is. We don't know what the request is that's being made. When there's litigation and emails need to be pulled, that's very common in an organization. You don't ask each person to send their emails. You do an email keyword search.
I'm not
And that's what we
asking
need
for
to
a
do as an
decision.
organization.
I'm just asking, Ms. Capasso has said she does not require approval, and I'm just saying, is that correct?
Approval for
For
the general counsel to look at emails in an investigation.
To do an email investigation.
So 2 weeks. Yeah, it's odd. 2 weeks ago.
You shut it off.
I'll talk on. 2 weeks ago, it came. I was shocked. I said, okay, this was something I hadn't seen. Again, I think it's because we have a new CIO. I think that's what happened. I said to Lynn, she said it's for this. I said, okay. That was it. It wasn't done.
But we just want a confirmation that it won't happen again, that nobody has to go
Well,
to.
how is she going to know that if somebody comes to her and say, "Is this okay?"
Well,
No, that I can then inform IT that there's no permission needed. I think that's what everybody agrees
Is
to.
that what the policy says?
There's not a policy on email.
Well,
Part of
it's fine, but
investigation.
you just said that
On
there was.
investigations.
On investigations. If
Can we just have the CIO take a look at it and make sure that it's where it needs to be? She's
It's a
came from
different
a
issue
very
from-
big
No, it's a
hospital
different issue.
system.
Let's get the current policy
all I'm
circulated so we
suggesting-
actually know what we're talking
Okay.
about, see if we need to modify it.
This document clearly spells that if there's a question or investigation or there's a protocol that should be followed, that the only individuals that are granted the authority to do investigations are the general counsel and the chief compliance officer. So if Ms. Capasso wanted an email from Nick, the chief compliance officer's email,
She should have gone to the general counsel.
I didn't want that email, and I object to what you're saying right
That's not
now.
what
That is not what happened, and I object
So how did you
to
get
that.
the email?
Because we asked Kathy, a CIO, to say, Nick was in a meeting with us and said, the emails were blocked from the CIO. I said, oh my God, are you kidding? From the OIG. I said, oh my gosh, that's horrible. Let me call Kathy. He said, well, I work with someone else. I said, Nick, this is important. I got up. I said, please get me Kathy on the phone. Kathy got on the phone. I said to her, Nick, the compliance officer, just told me, Alan, Gino, and Dr. Ta that the OIG's email was blocked. Please check to make sure any mail to or from the OIG is not blocked. I said, because he said it was blocked a week ago, whatever. She came back and she said, it's not blocked. I don't see where any of it was blocked. The only one I found, as a matter of fact, is Nick was able to send an email to the OIG. I said, oh, thank God, because make sure from this point on, nothing is ever blocked to or from the OIG. That's how it happened.
And that's perfectly appropriate.
I think
I mean, if our federal monitor is sending us emails to our chief compliance officer and he says they're not getting through, we need to make sure that that doesn't happen.
The thing that's quite frankly pissing me off right now is that something's on the agenda. We've got two people that seem to know anything and everything about an issue, and you got three people that don't. Okay? That can't happen. We are not going to have an agenda policy that just throws stuff on an agenda by anybody in under the sun, that we are going to just sit here and debate and discuss and have had zero information, zero conversation, zero disclosure. You just show up with I mean, it's not the way things should be run.
Commissioner Yuri, I got the agenda delivered to my house Thursday or Friday. I saw this item on the agenda. I asked what it was. Okay? I said, what is this about? We're looking at the organization email policy. I asked a few questions. I asked, do we have a policy? I asked for a copy of the policy. I read the policy. What I'm concerned is that if we have a policy, that we follow it, that we don't expose anything within the chief compliance officer's email to anybody other than who has the authority to look at it.
So let's do a couple things here. One, if there is a current policy, which you have, I haven't seen that either. We continue to follow that until a new one is made. At the same time, we ask the CIO. Is that the title, CIO? Okay. We ask the CIO to come up with a corporate policy, including looking at that and potentially offering revisions if needed. But until then, I don't see any reason why General Counsel or the compliance officer would have any restrictions. Of course, with the exception, I'm not big on fishing expeditions.
Absolutely.
There's a purpose, there's a reason. You know how to use that. We've hired you. We trust you to do the right thing, and that's really where I want to go. I do think it needs clarification. Obviously, you see that there needs to be clarification.
It's frustrating to me that when I ask the general counsel a question, she says I can't. I have to go to the CEO to ask for an email search.
But here's another.
I understand, but that policy should not be. That's not the policy.
Commissioner Wellens, I don't believe it's. If the rest of the commissioners would agree that we have a policy right now, we will follow that pending the CIO giving us a new policy, potentially looking at that. I think everybody's happy and we can go forward.
So
right?
just to make sure that it's very clear, because we are where we are with the report, the IRO report, I move that neither Mr. Hartfield nor Ms. Barrett be required to seek permission to do any email investigation that they deem necessary to do their jobs.
I second it.
The motion's been made and seconded. Is there comment on is there discussion on the motion?
I would just simply move that we remind staff that we have a policy. It's policy GA whatever blah blah blah, and that policy should be followed.
That policy allows IT to intercept. If you look at E, it allows it. So if the board has an issue with IT looking at blocked emails, that IT doing that, then that needs to be changed in the policy.
And I'm going to move to table the motion because
I know.
the motion is clearly premature. Without any supporting documentation, there's no way for us to address this motion. It's vague, and this discussion really should never have been on the agenda without any supporting material. So I move to table the motion. That motion, is there a second to that motion to table? The motion's been made and seconded. All those in favor of tabling this item, please say aye. Aye. Any opposed?
No.
Okay, so the motion fails. The discussion continues on the original motion, which is to have this new policy adopted.
The motion is consistent with the representation that permission is not necessary. So the motion does nothing more than adopt what is already happening.
Well, let me ask you a question. Well, let me ask you a question relative. Well, let me ask you a question relative to the motion. Alan, let me ask you a question relative to the motion. If our chief compliance officer has an email, and does the general counsel have the ability to investigate his emails, look into his emails, or his staff?
I would presume the answer is
According to
yes.
the policy, if there's an issue or a complaint or investigation regarding the chief compliance officer or somebody in the compliance department, general counsel would investigate, and the chief compliance officer would investigate the general counsel or anybody on the legal team.
Okay, so now we have a situation where our chief compliance officer, who reports directly to the board and is supposed to be independent, can be investigated by our general counsel, which is completely inappropriate. So those two folks need to be separate. And if we have our people looking at each other's emails, what if there's a complaint about someone in general counsel's office? And then general counsel says, well, I want to investigate, compliance, and now you're looking at his emails, and he's supposed to be independent, looking at whether we're complying with federal law. This is a ridiculous road to go down in the dark. I mean, right now, we have no guidelines that are before us. We have a vague motion which basically gives potentially unfettered authority. I don't see why we would go down this road without having something concrete in front of us to
Except
adopt
that
as a
according
policy.
to administration, it's consistent with what is happening now, that no permission is necessary. My motion is simply adopt what is the current procedure via motion.
Where's that
So we
procedure
have some-
documented?
Ms. Capasso told us she does not require Ms. Barrett to ask her for
Why
permission.
can't we rely on that statement?
I wish we could. I asked if we could rely on that statement that it will not happen in the future, that no permission is necessary.
At the end of the day, this policy is what's in place right now.
Well, we have a motion, we have a second.
I'm talking on the motion. There's a policy in place. I am all for reiterating that we have a policy in place and that we expect that policy to be followed. I'm not interested in going beyond the policy right now without having had appropriate time to address whatever it is going to be the bigger policy or any particular change. And to my knowledge, the existing policy, at least it's been purported, I haven't had a chance to review it, but the existing policy is consistent with what you're saying. So that's my suggestion. I'm not interested in creating new policy.
Nowhere in,
existing policy.
nowhere in this does it say that the general counsel or the chief compliance officer would have to obtain permission from the CEO.
Great. Then we have a policy in place.
Right, but that's
and we
not
expect our policy
that's
to
the
be
policy,
followed.
but that's not the procedure that
Why did it start?
I think because
What-
she's new. I think
No. Why did you have to get permission?
we don't
When did it
When
happen?
Colleen Grant was here,
So this is
and
not
then it was
new.
rescinded by the board, but the IT department,
Just let her finish.
the IT department still has the understanding that I have to get permission from the CEO.
Today.
Today, I got it
Okay.
today and yesterday.
So Ms.
IT
Capasso,
said-
will you clarify? She's your direct report, right? IT
No,
CIO.
she reports-
Right, will you clarify to her that there is a current policy that does not get in her way? If they
No
will do
permission.
that, will you withdraw your motion?
I will.
That's
Tomorrow.
what we've been trying to say. Is there's
This is
it's not in the policy. If we
giant
need
waste
to
of time.
redo the policy, then we'll redo the policy.
And at the same time, you'll ask the CIO to give us a policy, a global policy.
To review that policy and make sure it's best practice.
Okay, so the motion's been withdrawn. There's nothing on the table.
Are you good?
Yeah, no, there's still the motion from
The shade.
The finance, the shade and
Yes,
whatever.
well, no, it's not, he's not.
Oh, okay, I thought
Alright,
you were
so-
saying nothing.
He's
on
closing the
shade.
issue.
Got it.
Right?
Okay, so there's two other items that need to be addressed. Well, there's commissioner comments. I don't know if there's any further comments. But
I have no comments.
Besides that, we have a shade session that was proposed earlier today. The committee meeting regarding legal matters and guidance. So we've asked that a shade session be scheduled.
It can't be following, but as soon as possible after a board meeting or that a special board meeting be held. As soon as practical.
So that'll be scheduled preferably on September 26th.
I can't, because I have to leave. Yeah.
Can we have it earlier in the day on September
I think
26th?
let Patty pick the
Well,
day.
maybe it'll be better if we talk about the second shade session, which is really strategic planning the next 3 to 5 years.
Do you want to walk those items on?
I thought we didn't do that already? We did.
Well,
because it was
it
right
was a
before the
unanimous
tax year.
action out of a previous committee, so it should have
It
been
has
on
to
the
be walked
consent
onto the
agenda.
agenda.
Okay, so I'll entertain a
It should have been on
motion
the
to,
consent agenda is what I'm
to
saying.
add to the agenda the topic of scheduling two shade sessions. Is there a motion to that effect?
So moved. We all already voted on this.
Okay, all those in favor?
Aye.
Okay, so now we have the new agenda items, which we'll call item 20, which is the shade sessions. There's two shade sessions that we're attempting to schedule. One, legal matters and guidance. The second one, strategic planning. Why don't we take the second one first, strategic planning? Is it possible for the commissioners to schedule that on September 26th when we're scheduled to have our September board meeting? Is everyone amenable to having the shade session scheduled for that date?
Well, you give a general topic that it has to be within the statute and that the LOI is going to be talked about at that meeting for the land.
So there are a lot of issues in it. It's not just that. There's
Right.
also potentially expanding services.
Acquisition
of property, working partnerships with other organizations, like organizations. I had like 4 things. I think that should cover us with most of what I want to discuss in that shade session without giving away the farm. So with those items, do we need to do anything from there?
Let me ask Patricia, do we have a time scheduled for our September 26th meeting yet?
Well, this one was at 3 p.m. It was going to be at 2:30, and we have the 5:30 tax hearing, so that is up to you.
Do we have any meetings before?
Not that I've been told at the moment. Possibly audit would want to meet, but I haven't talked to Nigel.
Can we do them that day before the board meeting starting at 11?
I believe
So
if
we
all
have to
of you
open
are
a public
available.
meeting and then make a motion to go into shade.
Correct.
Okay.
So then, but they're two different, right? The one is the litigation, and then the other is for the land LOI, and
I would do litigation first because I think that'll be faster. Well, it's a limited litigation one. I think it'll be faster from 11 to 12:30.
assuming counsel is available for the litigation side, because that's outside counsel has to be available.
Well, at least some of the litigated matters, I'm sure they'd be available.
Strategic would be from 1:30 to.
Is the land LOI the?
That's one of the items.
Yeah, that's going to go to shade.
That's one of the
Well,
items.
how else do you discuss the LOI?
Okay, I was going to do the
How time
briefing.
sensitive is it?
Very. We're already past the time frame.
You need board approval.
No. I mean, I was going to give
He wants
board.
to walk it out.
I was going to put it on the 26th. I was going to do board briefings individual, and then present it at board. I mean, taking a risk with what kind of discussion is going to happen, but.
So, I mean, it's up to you, but the LOI has to be approved by the board
Yeah.
before it can be signed.
Yeah, I was going to have them
Or
approve
the
it on
land
the 20,
on the Wells Fargo land. So,
That-
Approval when?
on the 26th.
well,
So we have
but
time.
it's, what?
The 26th.
So if we have the
September.
shade
You got an
first,
extension of time?
No, I didn't.
No, you didn't, okay.
So let's bring it then.
So it could be strategic or whatever.
Okay, let's bring it to strategic.
It'll be that day.
That's fine.
Okay.
Okay.
It could be that, right?
All right, so we'll convene on September 26th at 11 a.m.
Which is 11 to, my proposal is 11 to 12:30. And then, what time's our meeting?
I believe be 3 o'clock if we're gonna repeat today.
Well, 5:30 is the tax hearing.
Yes.
So we know we're going to be there until 5:30. So if we do the second strategic planning, 12:30 to 2, we could start board at 2. Gives us another fun 2.5 hours before the tax hearing. That works.
If the board starts at 3, I was thinking 11 to 12:30, then 12:30 to 3 for the second shape meeting, for the strategic shape.
Why don't we schedule board for 3, and hopefully in the second seed session at 12:30.
Board is scheduled for 3. I think.
Can I ask?
Right.
Can I ask staff
Yeah.
to prepare documents for
30
the shape
latest.
meeting?
Yes, but before the documents go out, they have to fit into one of those
Yeah, I get that
exceptions.
part, but I can.
So I need to review
to
them
make it-
before.
I'll
Sure.
send them to you, and then you'll give them to them.
Okay, so Patricia, are you?
I have it.
So what do you have in terms of our schedule?
11 to 12:30, the first shade for the legal case. 12:30 to 3 for the second shade for strategic planning for the next 3 to 5 years. And board at 3 p.m. and tax hearing at 5:30 p.m. and hard stop at 6:30 for Commissioner Yuri.
Correct? Is it 3 years?
Well,
I was asking.
it might be a 3 to 5 year plan. There's parts of it that might be 5 years.
Do we have to list an individual?
It'll take us 2 years to start.
Strategy.
You have to ask General Counsel, Sparrow, to ask the question.
Do we have to put down for the strategy what we want to discuss, the LOI? It has to.
Well,
here now?
no.
Oh, okay.
No, but the agenda items, so that I can make sure that every aspect of it falls within one of those exceptions. So, no, and that doesn't get published, just so everybody's aware, it doesn't get published on the website because it is strategic and it's closed.
All right. Is there anything further? If not, I'll entertain a motion to adjourn. So moved. Second.
Second.
Seconded. All those